Welcome to another episode of the Indy and Dots podcast. We are joined by two special guests. First one is my sister Harpreet, and the second one is my brother-in-law Amardip. They are both business owners. They run their own independent business named Harper Cooper in Cheltenham. They're opticians by day and parents by night/weekends, and also the day. I don't want to get any flack. Okay. Harpreet's my sister, as I've mentioned, and they've both come on today to discuss with us a topic that's not really spoken about much in minority communities: fertility and their fertility journey, which has been quite difficult. I just want to open it up by saying, Harpreet, my sister, I call her Benji. She is reached notoriety across the UK by making it to the James O'Brien show last week. So tell us how that was, talking about this very topic.
So James was talking about, there was an article on the news last week about why women over 30 or up to 30 haven't had children. I think 0.96 was the average number of children women had by the age of 30. What were some of the reasons why? So I thought, okay, interesting debate. I have something to contribute towards this. This is something quite close to my heart. So I gave him a call and I said, this is something that's quite a big thing in the Asian community. Not because women don't want to, but there is a high percentage of secondary infertility. Women who have been trying to conceive and they can't for whatever reasons may be. It's quite multi-layered, the reasons why they can't conceive, for example. There's no reason given, it's just secondary infertility. Part of it is environmental, it's stress, there's a lot of pressure from families. And I discussed, things that I had gone through, pressure-wise.
Together and about bunchman. It's fantastic.
Yeah, which didn't help. So and that was my claim to fame last Friday, talking about infertility, difficulty in conception in the Asian community. That's what I can contribute towards. So it was, he was very nice. He listened to what I had to say, and he been the same thing as well himself. Him and his wife had tried a long time to have children. And he understood the pressure from a Catholic background, similar to an Asian background as well. Big families.
Which you wouldn't think that they're similar at all. But in terms of traditions and values, maybe families, they have a lot in common.
Yeah. Don't use contraception.
Yeah, similarities in the Irish community and Asian community, big time. Especially the drinking.
But yeah, when you go to Ireland, they're like, and we went there on a stag, and they were like, "You guys are basically us. You're just Punjabi version of us."
Yeah.
We have fight, you have fight. That's it. They're just
True. Weddings are big. You invite every Tom, Dick, and Harry, and their neighbour as well.
Yep.
Very similar. Yeah, principles.
I agree. Okay, so how long was your fertility journey in totality? So let's just go from the top. Give us like a brief, not roadmap, but like a rundown of when you guys began trying to when you guys eventually managed to have kids.
And the precursor to that, when did you get married first? Like just there as well. Like
when I was a wee little boy. That's the answer. Okay.
Wee little boy.
I should have asked to share the screen to show the pictures.
There we go.
We got married in 2005. I think we met in 2002. She's going to correct me all the way now. It wasn't 2002. It was 2002.
It was. Mussy, he remembers that. 20 years ago this year we met.
It was 20 years ago.
He's prepping for the call, man. He's got all the dates written down.
2005 when we got married. 2000 we got married. Lived in my parents' home.
How old were you guys when you got married?
I was 28.
Okay. I was 24. We met when I was 21.
Right, 28 for a guy is kind of like, I'd say the average kind of age of guys get married now. My feeling is it used to be a lot younger. I got married at 27. Indy, how old are you when you got married? 27, 20?
29, just.
29, yeah. But I mean, the trend tends to be that. Okay, fine, okay.
But this was 17 years ago. So you're right, it was younger then.
True.
It was much younger then.
It felt old for me to get married at 28. All my cousins got married really young. One, 19.
Whoa.
I've got cousins.
So you're at uni or didn't go to uni like that?
University, yeah. So we did optometry. University finished. So I've got 2 degrees. I did my first degree in
the tuition fees were nothing, man.
Yeah.
It was as many degrees as you want.
Listen up, kids. We're going down memory lane. All right.
Degrees like. So I did, yeah. So I was, just toddling around, figuring out what I want to do. So that's why. So I qualified as an optometrist in 2004. We'd met 2002. So, marriage was sort of on the cards. Married 2005, lived with my parents, and it was living with any parents is always stressful because you want to put your stamp on your marriage, but then as a man you're being pulled by your mum, your wife, and you just feel under the cosh. So the pressure's there from day one. Pressure's there from day one. We started trying, so 2009-ish. We didn't start
So
trying.
how many years into marriage then?
4 years into marriage. Is that about right?
Okay.
Yeah.
We had a miscarriage at first, didn't we? Miscarriage.
We had 2 or 3 miscarriages.
First
A big
miscarriage.
miscarriage was 2000 and
Early 2010.
when we took in the business. 2009 was our first miscarriage.
Late 2009. wasn't it?
November 2009. Yeah, November 2009.
So we took
2 years
over.
after we took the business.
Yeah, so we took over a business, a big franchise business in 2007. So yeah, 2 years into being qualified. So that went well. Then late 2009, we miscarried. And that really hit us because as Indians, you're thought, you get married, Karla, baby comes. That's it, isn't it? But
Well, that's it. It's the normal trajectory.
Karla.
Yeah.
That's 100% going to be the
Well, I
category
don't know.
for this.
Are we PG rated?
Well, I was gonna say, I mean, how parents tell you it's time to have a baby, that must be like an interesting phrase. The other day, my dad
conversation
actually
came up, yeah.
came home and he goes, my dad's quite formal. He's like, oh, this is a little bit embarrassing for me. I just want to ask you both something. Me and Shindy were both there. I was like, Dad, I know what it is. We're starting this year. He was like, okay, fine. That was the end of the conversation. That was it. So yeah, I'll be interested to see, Indy, what you get, man, in terms of the Kama Karla phrase.
I don't think I'll hear it.
No, yours gonna be what tenu anda? I had a cousin who actually got asked that. He told me once at the pub. And again, we'll come on to this, obviously. Him and his wife have been trying for a long time. Perception from the parents was they don't care about this, they're not trying. And he got asked, like, in a funny kind of half serious, half funny way, do you know what you're doing? And he told me, and I was like, bloody hell, man, it's not on, is it really? Like you can laugh about it, but it's just, it's not on.
Do you know what you're doing? My God, should I show you a tutorial? Jeez.
Do you know what I mean? Side note,
That's
guys.
nothing.
This will make you laugh, okay? So when I was a 5th year medical student, I was in a gum clinic, gentry urinary medicine, okay? So sexual disease and stuff. No lie, this couple came in, didn't speak any English, and they couldn't conceive. And so the doctor was like, just, tell me about what you do, what's your frequency and schedule, right? This guy thought the female reproductive part was the belly button on the lady. No lie.
Oh, man.
Right? So he was like, I've been trying and nothing's happening. We were there. I was a student time in the clinic. And I was like, oh my God.
What did he think the belly button on a man did?
that wasn't asked, but he was trying very hard to impregnate somebody. Obviously, because he knew about, like, he didn't do something about umbilical cord, and obviously the baby's there, and he was like, he's trying to get in. And then the consultant tried to get this like model, and he still didn't get it. So she had to draw this diagram for him, and I was just like, oh my God, you don't think these things, but
just to clarify, that's not why we didn't get pregnant.
Yes.
Let me just make that very
2 degrees.
clear,
2 degrees knew exactly what he's doing.
Yeah.
Can I just say the best side note on here?
Yeah.
The best cringe thing that ever happened was when our grandma, our nanny, gave me sexual advice.
Whoa, wait, what?
Wait,
I
in
hadn't heard
Punjabi.
this story.
It's
Huh?
just-
In
Best thing about this
Punjabi.
podcast, some things just come to light. Exclusive, guys. This is exclusive, right? Are you going to share, or are you going to give us the gist of it, or?
I'm happy to share because I was dying inside. So we called our nanny Mom, M-O-M.
Yeah.
And we're trying a few years, and she was like, "Saara kuch theek hai?" And I was like, "Hanji Mom, saara kuch theek hai."
Okay,
Just
good open
halle
question.
aaya nahi.
Yeah.
And she goes, "Main gallan kardi si mere friend naal." I'm like, "Acha." And she said, "Oh, maine dasya. Then tere period the baad tu apne brother naal lamma pao." And I was just like, she called it lying down, and I was like, "Acha." And she goes, then the baad fir din the baby aayega." And I'm just like, okay. She wasn't far off. 3 days after you finish your period, you are pretty fertile.
Right.
But it was the way that she said it. And then she's like, "Fair to see." She said, the way she said it was, "Lay with your husband." And I'm like, okay, we've been doing that, but thank you for
This
that.
sounds like some Queen's way of saying it, lay with your husband. Did you lay with your husband
formally.
last night?
I was just like,
Did she deliver it
and I'm
straight
just like,
faced?
yes, very straight face.
No.
It was very matter of fact.
Brilliant.
Deliver what? I love what he's thinking. Deliver
How did
what?
you think she delivered it?
No. It was just in Punjabi, it's like din din the baad. It sounds like a ransom note, man. It's just like din din the baad. Hoga. Fir tu edda kari. Like it's so dramatic. And then fir ut
It was the
baby ho
whole.
jana.
What got me was that she discussed it with her friends on the
A
phone.
friend, which is normal
So-
apparently.
Yeah, and they're like, ਸਾਡੀ ਕੁੜੀ ਸਾਨੂੰ ਹਿੱਦਾਂ ਹੋਏ ਕਿੰਨੇ ਸਾਲ ਹੋਏ ਦੇ ਵਿਆਹ ਹੋਈ ਔਰ ਇੰਨੇ ਸਾਲ ਹਲੇ ਬੇਬੀ ਨਹੀਂ ਆਏ ਨੇ ਅੱਛਾ ਸਾਡੇ ਵੀ ਹਿੱਦਾਂ ਕੁੜੀ ਹੋਈ ਜੇ they did this and they're sharing it with good intentions, but it's still mortifying when your 80-year-old grandma is telling you when you should be having sex. I'm like, grandma, I don't need to be hearing this. This is just
There was an expectation for you to be pregnant pretty much a couple of months after the wedding. There used to be that expectation.
And you knew that, like as in you felt it or you were told that?
It's I think our parents were fairly well. My mum's much more traditional. My dad would never go there in a conversation.
Okay.
My mum would, if tradition dictates it was 5 months after you start asking, she'd wait 5.5 months. So she was like,
leeway.
Yeah. So she'd wait a little bit longer. But people were saying even before we started trying, are you guys not going to have babies? Are you when are the kids coming? They say, you're married now, have kids. I'm like, well, hang on.
there's a schedule apparently.
Yeah.
There's a schedule.
But you guys, because you mentioned the 4 years, so was that a conscious decision that we're married, want to enjoy our married life, do da, which I would say the couples now, my friends' generation, definitely the way we think. Most of our friends now are kind of 4 or 5 years in. And then it's like, okay, we've had our kind of holiday time, happy time, whatever you want to call it. Now let's da. Back then, it obviously wasn't the norm, but what was your thinking at the time?
Bit different for us because Dips was older than me. A lot of his friends got married similar ages and they'd already had one kid or they were already pregnant. So we felt more pressure to conceive earlier. I didn't really want to because we had just bought the business. And I was like, well, I don't think I really want to do this yet. I'm not ready to do that. I don't really want to do that just yet. So I felt pressure personally to conceive earlier. And I was the one who said, I don't want to yet. And then I felt guilty because he wanted to, because his friends had children and I didn't want to. So I felt like I was holding us back. But I was mindful that as soon as we became pregnant, I didn't have to stay at home for a year. Not have to stay at home, but then I would be at the business. And the business was only 2 years old. And I was actually really enjoying it. I didn't want to give it up straight away so quickly. So that put a bit of friction between us on who was going to, have the conversation. We had the conversation and it was really difficult. Those conversations were really hard. I was 24 when we got married. I didn't know what I wanted to do then. And that's a young age to do something like that. Took business when we were 26. So I wasn't ready. Dips was definitely ready. And that was really hard.
But you talk to each other. That's important.
Talk about everything.
And I'd say for some couples though, when some of my friends will ask me, what do you think about this? What do you think about this? The first question has to be, have you discussed it with your partner, man? That has to be the forefront of these things, because these things otherwise can just build up in your head and you don't know what the other person's thinking. Okay, so how did it go from there? So there's expectation, you had friends, and then at some point there was a conscious decision to, okay, let's start trying.
Yeah, we did. And
So
I remember
go on.
when. Go on.
I was going to say, so the first time that we thought, okay, we're not going to use any contraception, this is when we're going to give it a shot. And then when I wasn't pregnant and I had a period, I was quite shocked. And I just couldn't really believe it, couldn't really fathom, because as teenage girls, it's been drummed into us at a really young age. If you have unprotected sex, you are going to get pregnant. You are going to get pregnant. You must use contraception. So when it didn't happen, I was just like, what? I got lied to. And I just thought, okay, fine. Didn't happen this month. But I find that really hard to get my head around. For a few days, I was in a bit of shock. Like, well, all that stuff from before, that didn't really apply right now, but it can take a year. So, okay, fine, it can take a year. And that was the beginning of oh, okay. Didn't know that was going to go like that. That was for me. I don't know how it was for you, Dippage.
I'm trying to think back now.
Mhm.
When you finally have kids, everything else is a blur. And it was like that. It was like that. And I suppose, you know, being married and in love, you have to enjoy the process as well of being with each other. So I don't know whether, I think when you first start, you're just impatient because you're ready for the next step in your life. You know, you want that kid here. You know, you can almost feel it and taste it. You just want that kid here. And then when it happened, I want to say about November-ish, 2009. I remember we had a test. It was pregnancy test at home. It was positive. We went round yours and told your mum and dad.
I remember that. I remember that evening. Yeah.
And then we miscarried straight away. You know, really
like the same weekend. Or
it was really early.
Because I remember I saw you guys at like on a card bar, and you told me, and I was like, "What?"
Yeah. Well, Harps called your mum, and mum said, "And mum, when it comes to sort of stuff, mum is very much, she's panicky. She's go to A&E right now."
You mean that
yeah.
Yeah.
Fine. Okay. So, you know, mum being the pharmacist, we took her advice, went there, and I've never felt, I remember this, I've never felt so belittled in my life. Do you remember?
No, I don't remember any of this.
No, we went to Sandwell A&E. We said that we were pregnant and we were miscarrying and you were bleeding. And the woman and the doctor on call just looked at us like we were just some, you know, crappy, poor couple off the street. Because we went first thing in the morning. We didn't even have showers and stuff. We just went in our pajamas and stuff. My hair was all over the shop, and Harps was dressed in her night clothes as well. And we just felt so tiny. It was horrible. And because you're in shock and you're in an elevated emotional state, you haven't got the capacity to challenge that terrible way you're being treated. So we went away. And that's the biggest thing I remember, that just the lack of compassion from the doctor. But that's a different story, I suppose. And then from then on, so this is coming into like early 2010, we just tried for a few months, and then we thought, okay, it's not happening. That sort of started dawning on us after 6 months in, and then that's when we decided to see a doctor.
Yeah.
And I can't remember whether we thought, well, the waiting lists are just ridiculous, so we'll just go private straight away.
No, hang on. We went to GP first, and she gave Clomid.
She did give Clomid. Okay, fine.
What's Clomid, guys?
Yeah, what's Clomid? I don't know.
It stimulates your follicles to produce eggs.
Not mine.
Okay.
So
I was gonna say,
follicles.
you got eggs. That's a problem. That's a big problem. Bigger
Well,
problem.
you got a belly button barge. Anything's possible. So you know.
This is why it doesn't work, isn't it? She gave Clomid.
Okay.
Which didn't really make sense in hindsight. We didn't have any tests done, didn't check any hormone levels. It was just have some Clomid. I'm like, oh, okay, fine, take some tablets. This might do what needs to be done. So that didn't work either.
I think that's a standard first step.
Yeah, take Clomid first.
Yeah, so I think whether the doctor had done the appropriate tests or not, he or she would have still given Clomid.
Okay.
And then we decided to look at IVF. No, hang on, we didn't do IVF then. No, we didn't know. Then the alternative advice started coming out.
What,
Chinese
like
medicine.
Chinese
medicine.
That alternative stuff. Okay.
So where did you seek that knowledge from?
Acupuncture. Now hang on, we had an IVF cycle, and then we did the acupuncture.
Yeah, no. So then it dawned on us, because you have to be trying for 1 year before they put you on Clomid.
And how do you prove that?
Right.
You don't have to prove that, presumably.
Well, yeah,
you
can't. The doctor will use their instincts as to whether they believe you or not. I'm assuming most. And we said, look, we have been trying. The doctor spoke to us, thought, yeah, these guys are telling the truth. Gave us a Clomid, and I think you can only take Clomid for 3 months. I might be wrong.
Okay. I think you're right on that.
I might be wrong. I might be getting my facts mixed up here with other stuff. But after 3 months, it didn't work, so we came off the Clomid. Yeah. And then we had a look at what else can we do. Okay, fine. So I don't know what the situation is now, but you know, with healthcare and postcode lotteries, every area has its own set regulations in terms of what they will allow or won't allow on IVF.
Oh,
you know, how long the
that's
waiting
nice.
list is, how many cycles they would pay
NHS.
for as well. And we were living
NHS idea.
in Walsall at the time, you know, not the richest.
Also,
Yeah,
also,
not the
down the
richest.
road from Doctor. Literally,
yeah.
where you guys used to live is really close to Goran. So yeah.
Oh,
So, you know, not the most, what's the word? Flush. It would have been PCG, CCG, whatever you want to call it. But anyway, so we thought, look, we don't want to wait. Let's go and have a private assessment done. So we saw a doctor there. They gave us
In
a couple of
Nottingham.
tests. Yeah. But no, it was in Priory in Birmingham first. Do you remember?
Oh yes, it was. You're right. Yeah.
Priory
Jesus
in
Christ,
Birmingham.
Yeah.
This is
So-
crazy how you guys are like, even just.
Well, we haven't talked about it in
pause you
ages.
there, yeah, exactly. But
Yeah.
also like the journey seems like it can be quite repetitive. It can be quite up and down. And there's bits that obviously you admit and just push that away and just think completely forgot about that, and then the other person will tell you.
Yeah.
So it's kind of showing through to sort of see how difficult it's actually been to keep memory and track of everything.
Yeah, well, I'm trying to remember as best as possibly can, because hopefully somebody will listen to this podcast and think, oh, you know what, this happens to people, and this is quite a common
What's the point of it?
journey. So, you know, so I just want to show how difficult the journey is. And we were lucky enough to be able to pay whatever we needed to pay to get these private tests done. So I had a sperm count done, Harps had, and then we both had some genetic tests done as well. And then you had your, I don't know what the name is, AMH levels or something like that.
Yeah. Anti-malarian hormone, checking
Yeah.
my
So
just checking the supply of eggs that I have left, because I have a finite number of eggs. Checks how many eggs you've got left, what's your fertility amount left over, basically.
yeah. So my and then they said, look, because it's private, they do every test.
Yeah.
We'll just do everything because they can charge you more, but never mind.
Yeah.
So I had my sperm test count done, and it was okay. They said it's fine. Harps had AMH levels, they were okay. And then our genetic tests, mine came out normal. And then at that point, it was discovered that Harps had something called Robertsonian translocation.
Oh, okay. Oh, Indy's told me about this. Yeah.
Which is where I forgot which chromosomes they are.
It's basically a couple of chromosomes.
12 and 13.
Chromosomes 12 and 13
Yeah.
or 22, 23
Yeah,
had
12 and
switched
13.
places.
Yeah.
What that means is that your chance of miscarriage is increased and your chance of pregnancy is reduced by 25% or 75%?
75%,
Or 75%.
because you've got a 25% outcome of having a normal, healthy delivery.
So
And then
out
the
of
75%.
so
you have,
out of
like,
every four
issues.
out of every four over
Yeah.
3 will have translocation, and out of those 3 they will probably miscarriage. So the chance of pregnancy were only 25% of whatever
Very,
your
very
daughter
small.
brings. Yeah,
And
tiny.
also, they could
So-
be born with a genetic defect of like Pate syndrome, where they have an enlarged head, or Down syndrome. There's an increased chance of that. Don't know what
Yeah.
the numbers are exactly,
Yeah.
but that is
So-
a thing. Yeah. And it
so
does
then-
affect women more than men.
So then they recommended
Significantly more.
Yeah.
IVF. So we went away, we did some research on IVF, and we came across a clinic in Nottingham. And they came across the clinic, had a look at their success rates. They were very high. Went to a few of their open evenings, and then we had a chat to them. They said, yeah, we can work with this. And then we went from there, and then they go in, and the idea is they give you your treatment, you know, your injections and all that sort of stuff. I'll tell you about that in a minute. I can't remember a lot of it. And then they do an egg retrieval process. They take my sperm, combine the two in a lab, and then ideally in a few days you're pregnant, and they insert that, and then hey presto, it's, you know, you're pregnant.
Right.
But it's the fertility, it's the IVF journey that's really hard.
Okay.
So they give you, so what they do first is they give hormones to depress the woman's cycle.
Okay.
Then they give
Enzymes
hormones
like a
to
chem-
elevate it very, very quickly to mature the eggs very fast.
Okay.
And then they extract them.
So when you say it's very difficult, do you mean it was taxing on your body schedule? Like when you just explain that to me, what does that mean when you say it was difficult?
So injections. So injection hearts, having injections,
okay.
2 injections or 3 injections every night.
Oh my God.
In her stomach. So I was administering the injections into her stomach. Then, various pills and, all sorts of
Tablets I had
medication.
to take, had to track my cycle militantly, work out what day was what, be ready to have blood tests at their beck and call. You're on day 3, you need to have a blood test, go to Nottingham, have a blood test. I'm trying to test and see my patients at the same time, trying to run a business, trying to get pregnant and trying to do all this kind of stuff as well. And then the hormones that you're giving, these big doses of hormones, and then they really play havoc with how you feel emotionally.
Right.
You can't tell anybody about it because you're scared about nuzzling it or jinxing it, just in case it doesn't work. Everyone's like, keep it to yourself, which is probably the worst thing that you can do. So we told, immediate family and friends who were going through it, but even still, there isn't much that they can do apart from listen to what you're going through. You're the one going through it ultimately yourselves. And I think the most difficult thing about having IVF is the roller coaster of emotions and the hope and then the devastation, and the hope and the devastation. And that's what I found the most difficult thing for the whole thing was, this could be it, this could be it, this is going to work. Then there was a hurdle, and I just didn't have a great coping mechanism because I felt so much pressure for it to work. I felt like I was letting dips down, that my body was the one that wasn't performing how it should be performing. And I found that really difficult. I remember crying into my bed, into my pillow at night time, saying to him, I'm really sorry I've let you down. I'm really sorry I've let you down. It's because of me that we can't get pregnant. It's because of this translocation that we can't get pregnant.
But that guilt you took upon yourself very, very personally.
When you know that you've got a defect, you're naturally going to think, you're probably going to come down harder on yourself because you're thinking it's clearly me, it's not you, because you had the test done. So you're probably going to think much more harshly of yourself.
Yeah. And, it was never discussed. We had genetic counselling. So we understood it, we knew all the facts and we understood that, we're scientists at heart and we get all that, but it doesn't mean it makes it any easier to process that when you're going through the process at the same time as well. I haven't thought about this for a really long time. So sorry, I'm going to get emotional because
that's okay.
Take your time.
Bringing back a lot of older things that you haven't thought about for a long time.
Yeah.
And it's the persistence of all of that. And what I found out was really difficult was where we used to work. So we used to own an opticians in Boots the Chemist, and it was on the top, it was on the second floor, first floor, and that was next to baby department. So baby clothes. I used to walk past.
Yeah.
I used to walk past baby clothes and dummies and nappies
and you had to walk past
baby
it
stuff
to get to our lockers
go to the
where we
loo.
kept our stuff and go to the toilet as well.
Yeah. So I used to walk past that on a daily basis, at least 3 or 4 times a day. I'd walk past that as a constant reminder, this is what you want. This is what you want, and you can't get this, and you're a failure. My self-talk was awful because I didn't know any better. I didn't know what self-talk meant because I just thought, well, it's me who's the failure. And every day I'm reminded of seeing fucking baby clothes on a regular basis. And suddenly, so there's this thing in behavioral psychology where when you start thinking about something, all you see is that around you. If I said to you guys, think about
red,
the VW ID3 or a red car, for example, all you're going to see is a red car or the ID3.
Yeah.
And suddenly, all I saw all day, every day were women in pushchairs, teenage girls with pushchairs who look like they weren't interested in being children, in parents.
right?
Who are being awful to their kids in the shops and shouting at them. I'm just like, how can you do that to your kid? You're so lucky you've got a kid. This is, my self-talk in my head. And then, the devastation when I'd go to the loo to go and see if I was pregnant, and I'd come out of the loo, Dips is there waiting on the bed and looking into his eyes and saying to him, hasn't worked. Or I started my period.
It's like a bereavement every time. It's like that. That's the feeling. That's the feeling.
The analogy.
I think I read something and at that time, and it is that describes it perfectly. It's like a bereavement because you get your hopes up, right? Because this medical procedure is going to help you.
And were you guys having that hope every month, or just when you were doing IVF? Or
so you can't. So I mean, I think at that time we were pretty much resigned to the fact that we're not going to get pregnant or have kids without some sort of medical intervention.
Yeah.
Okay.
And when that and it didn't work that first time.
The IVF we're talking about now, yeah.
Yeah, it didn't work.
Yeah.
So
Okay.
So what you do is,
I had
like
a
I said,
hyperreaction.
so
I
you
remember I
can
had the
become,
hyperreaction as well.
yeah. So you can have a hyperreaction to the medications, so because, like I said, they depress your
the levels,
ovulation, and then they rapidly increase it. For young women, that can be dangerous.
Okay.
And it's life threatening. That's how dangerous it is.
Oh, bloody hell.
Yeah.
Okay.
So, and what it also does, it produces poor quality eggs at the same time as well.
Yeah.
Yes.
So what they do is they go in and they say, look, thank you. So they have this really, really invasive procedure afterwards to extract the eggs.
Right.
You're under anesthetic. You're under general, aren't you? You're under general.
Oh, bloody hell.
It was
bloody
like
hell.
it was like
Yeah,
it was like
right
a propofol something. It was like a sleeping. I was in deep sleep, but not, I don't remember.
Did you
I
have
remember,
a ventilator or no?
I don't remember.
You wouldn't have
I
known, to
really
be fair.
don't know.
Okay. You either very heavily sedated, but still, I
Yeah.
mean, this
I think I was heavily sedated.
It's
highly
very
invasive. What you said, bloody
It's
hell,
really
okay.
invasive. Yeah.
Yeah.
So
And
they
then
did
you-
that.
And
Go on,
then
Karen.
and then when you wake up, the first thing you say is, "How many eggs did you get?"
Yeah.
That was the first thing I said was, "How
Jeez.
many did you get?" And they said,
Hmm.
I think they got about 16 or 20, which was way more than you should have had. What they
Okay.
really aim for is like 10 or 12.
Good
had like
quality
20.
eggs,
Yeah, you want 10 or 12 is a
Yeah.
good number. I had
Yeah.
like 20 plus. Like,
Yeah,
oh, I didn't really. I was
because-
like, oh, okay, that's really good. I didn't know that. I didn't know then that was not a good thing. I'd just been hyperstimulated.
So they weren't particularly good
And I
quality. Is that the
They
Yeah,
weren't. None
okay,
of them
basically.
were good quality.
right?
And then
So-
when we had our review with the consultant,
Hmm.
I remember him being quite perplexed. He couldn't work out why we had so many eggs, and for some reason they contained no DNA. So the eggs that I produced had no DNA in them, and he was
Okay.
like,
So they're not viable at all.
"Are you
then,
No, not viable." He's like, "Are you vegetarian?" I'm like, "No." "Did you take Charlie's medicine?"
huh?
"No."
This is the first
"Are you
question.
on steroids?" "No."
Yeah.
Yeah, he was
"Taking
fishing.
drugs?"
He was
"No."
fishing. So
I'm like, "No." And he
Hmm.
couldn't give a reason why these eggs had no DNA. So that should have been like a bit of a trigger for us. Like, this isn't really going to work for us in this way.
Hmm.
they
And
weren't very
then they talked about
sympathetic, were they, to it
no,
failing?
because we were skewing their figures.
Yeah.
Yeah, I was
basically, yeah.
thinking that because you've gone to such a successful clinic, you're like, oh, you're going to be the bad ones. You got to write down. You're bringing us
But this,
Yeah, you
successful.
gotta
well,
fuck up our
this is the thing about private clinics, and
Hmm.
so I mean, this happens with our cataract patients as well. You send them somewhere and they go, well, I've had a look at their figures and they're far better than the NHS. And so, well, the NHS do all the complicated surgery. So their figures are going to be poorer because they
Right.
do more
Yeah.
and they take these very complicated cases on. And our case was obviously, you can hear, was more complicated. And when it didn't work, he was fishing. He was like, well, did you? And it was just, when you have the open evening, they say, make sure you don't do certain things like eat certain types of food,
Right.
which can help reduce your chance of fertility. And these foods, yeah, they do help reduce it, but they're not going to dramatically reduce
Yeah,
your
I
chances.
remember once I
it's
was
not
eating
like-
food at yours, and Benji said, I offered her peas, and she said, I don't like peas. And I was like, what? I've never noticed this about you. And then I remember months later, you told me, like, yeah, I can't have peas because it affects my chances of having kids. I don't
Yeah.
want to say it in front of everyone. And I was like,
Yeah.
really? Peas? And you were like, yeah,
Everything was about marginal gains.
yeah.
Whatever you can
any
do,
percentage.
your
Yeah.
your lifestyle has to change around everything that you're doing. So, like no caffeine, no
Right.
alcohol, no hot baths, no
No hot
pea. No,
baths.
there's,
Oh, my
there's
God.
protein in peas that you shouldn't be having, for example. All sorts of stuff. So I have to change everything that I live my life to adapt to something like this, because
And
that's the criteria put on my body as the vessel.
And
Wow.
I don't know how much significant evidence you'll find that a lot of this has significant impacts on it. But the guy was clearly fishing, and so we just thought, look, we don't want to. Well, Harps is emotionally really hurt by it. From a man's point of view, it's hard because you're like, let's go again. Is what you're thinking,
Right.
partly.
Yeah.
Because you can't have any idea. But obviously, you're not going to say that. Well, let's go next month. But you are thinking, well, that's okay. Well, I can just go again, because you don't know,
from
you don't
your
understand
point of
it.
view,
Yeah.
From Harp, so we painted a picture of how taxing this was on you. whole lifestyle, multiple interventions, logistically, so much. From your point of view, what was the parallel experience? Obviously, you produced your sample, but were you on injections and tablets and having blood tests and things?
No.
Nothing.
Okay.
No.
Okay. Yeah.
Well, I wasn't.
Which is why you were
nothing.
like, let's go again. Like,
Yeah, that's what I mean, you're not stupid enough to say it, right? You have to read the room a little bit.
Yeah.
to understand. So, but that does cross your head. Well, next time we'll do this instead. Actually, I don't want to know. I don't think I want to do next time, at least for a long, long time to come. And part of you is thinking, okay, look, I need to be sensitive and empathetic. But the other part, there's a tiny part of you as a man that says, well, why not? On injections. So there's an internal conflict in a man that says to you, you need to, because I'm also in a hyper emotional state, not to say anything stupid. And I know I said lots of dumb shit.
Right. In that meeting.
Yeah, no, just throughout the whole journey.
Oh,
throughout the whole journey. But I knew that this doctor is just fishing.
Right.
I'd have more respect for him if he said, guys, it hasn't worked. Look, I don't know why it hasn't worked, but
the honesty of it.
Let me go back, let me research it, and I'll come back to you with some answers, and maybe we can try something different next time if you want to do it next time. There was no counselling with them, and they always say, I will give you counselling if you want it. Well, no one thinks they need counselling.
Right.
It should be mandatory if you're going to go through something like that.
Well, there should be at least an empathetic doctor there. So, I mean, if any advice, I'd say, look, just make sure you connect with your doctor if there's a. And I
presume with this being, they must have some sort of disclaimer. Do they have a sort of, we don't guarantee X, Y, Z. If this doesn't work, you don't get like another free shot or anything. There's nothing like that, is it? It's just
no, there's no buy one get one free on this.
But even in the case of there, like we said, well, if there's no viable eggs, like you'd think, if there's anything else, like surely.
I
thought. That's not, do you know what I mean? That's not my fault.
I thought there was.
Yeah.
I thought there was like your second round is like 25% off or something. I think there might.
I don't know, but then we started doing the Chinese herbal stuff. So they said, have you thought about doing acupuncture?
Okay.
So there was a clinic in Sheffield. There's a woman in Sheffield, and the woman in Sheffield, she said she was an acupuncturist, fertility acupuncturist. Now, I don't really like needles very much. However, I felt incredible pressure to do this for Dips and for me.
Just to try anything.
To try anything.
Yeah.
So for a year, I drove from Warsaw to Sheffield on my day off.
Sheffield. Oh my God.
Yeah, Sheffield, which was 75 miles one way. Had acupuncture for an hour. And it wasn't exactly relaxing because you've got to lie there and
can't move.
have needles stick in you and you can't move for an hour. And then I was taking Chinese herbal medicine as well. I didn't really feel much benefit to this. And I did it for a year and it exhausted me. I found it really hard. I used to go on my own because Dips would be at work. Sometimes he would come, he'd come with us on some days as well, just to share the journey and stuff. Everyone's like, oh, when you come back from acupuncture, relax. I'm like, yeah, okay, I'll just relax.
Every Thursday.
Every Thursday. Yeah, you need to relax. I'm just like, okay, so I'll just sit at home and do fuck all because that's apparently relaxing.
Probably more stressful, isn't it?
Yeah, it is. You're thinking, is it going to work? And have I done it? Have I laid still enough? And are you taking the right tablets? And all of that kind of stuff. And then I remember when I was going to go for an appointment about a year later, and I remember sitting in the stock room of work, calling the acupuncturist and leaving her a message on the phone in floods of tears saying, I'm sorry, I can't come and do this anymore. I'm done with this. I used to hear stories from her about her patients who'd been successful because they'd had this, treatment with her. So I was holding on, maybe that'll be us. That could be us one day. Maybe that'll be me. That would be my lucky chance.
Yeah.
And I just remember sitting on the floor, just thinking, I can't do this. I'm just so tired, and I don't want to do this anymore. And I just shut down.
She had more empathy than the doctor, I think, to be honest.
She did. Yeah, she did. Yeah. And then I just shut down. I didn't want to do anything. And for maybe a year or two, we did nothing.
So which year is this to have like a bit of an idea?
Timeline.
2010.
No. Around Bakit's wedding time.
So
So
2012.
Just before that, about
Mm.
2011, I'm like, I'm done. I don't
So
want to try
after-
anymore.
So at that point, Hobbs, your headspace is obviously you're physically, emotionally exhausted, but it's
Yeah.
I don't want to have kids. I want to break. Where's your head at?
I want
at
to
that
break.
point? I want to
I
break.
want to break, but I don't know when I want to start again.
Right. Okay. Yeah.
And
And you're
that was
thinking
very
the clock's
difficult.
ticking. Is this a good idea?
Mm.
Yeah.
But I'm also thinking, other stuff was difficult, in the business, and we were still living with, like in-laws and stuff.
Mhm.
We wanted our own space. That was quite
Yeah.
difficult. We didn't really have our own space and didn't really have our own privacy, which was quite difficult. We only had like our bedroom really, and you
Mhm.
can't really relax and sleep in there and stuff as well. We needed more space for ourselves. Then we focused on moving out. So
Okay.
that was our focus for us. We wanted to move out and work closer to home, but be closer to work.
Mhm.
And I just magically thought that if we move out, we'll then have some more space for ourselves and we'll
Mhm.
be a bit more comfortable. Things will then work out better for us.
As in this, that's
And-
one of the variables of stress that may come down, and then
Yeah,
And the ability
for
to
sure.
unwind and stuff. Yeah, it's back in your control.
Yeah, exactly.
Mhm.
But then, so we moved from a family of, there were 6 of us in that house, Dips's mum and dad, 2 sisters, me and him, and the dog.
And the
We
dog.
moved into
Let's
our
not forget
house
the
and the
dog.
dog.
Okay.
And the dog. And then we moved into our house, just the 2 of us,
Okay.
and it was silent. It was a really quiet house. And
Okay.
Dips then found that very difficult to cope with. And he spiraled into quite a dark place in terms of, it's never going to happen for us. A constant theme for him was, there's
Mm.
no Ronak in our house. And in the meantime, our friends are all having more kids, not having just one. They're having 2, 3 by this time. They're
Right.
like pumping them out.
Making it look easy, and
Making
whatever.
it look
whatever.
easy.
Bastards.
Yeah, exactly. Those people like, I just look at my wife and then she gets pregnant, like one of those. Like, goodness
Yeah.
gracious me, my son, he just looks at her
Yeah.
and she gets pregnant.
That's the one.
And Dips, for you,
Yeah.
your 2 degrees, did you stay at home? Did you live out?
I lived out. So
You lived out,
I
okay.
did, yeah. Well,
But
I
8
spent,
years.
Okay, fine. But you've had both the experience of being in a house with lots of family and growing up with your sisters and all that kind of thing. But you've also lived out, but then going to just you 2. So when Harp says the silence, obviously you guys are still communicating to each other, but it was just there was no other kind of conversations that happening.
Yeah,
Is that what it was, or?
I think I was so ready for the next phase of life,
Mm,
and you dwell on it. It's like it hasn't worked. It's never going to work, and then you just get deeper and deeper, and then I had some counselling as well.
Mm.
And then so the counselling was really helpful.
Was the counselling a good time for you in terms of, because everything was so quiet, you had no choice but to face your emotions and thoughts? So you were thinking, maybe I just need to talk to someone and just clear my head a little bit, because as you said, you're feeling this pressure of not having any Ronak at home, which is a bit of a distraction.
Yeah, maybe, kind of. I mean, I think with counselling,
You were low for about 18 months.
that was
And the turnaround was when you said to me, I think I want to go and have some counselling. And I remember the relief
Okay.
that I felt that you'd said that, and how happy I was to hear you saying, I want to do something different now. I'm tired of feeling this way. And I couldn't ask you to do that. You had to do it for yourself.
So Dips, this is really, really important, especially for, again, with our community. So what was the point where you gained that awareness and you had that conscious decision that, yes, I want some objectivity on this, I want to get some help? What was that moment? I need to go there.
I think it was a realization that I'm just tired of feeling this way. I don't want to feel like this way anymore. And that doesn't come. That wasn't a light bulb for me, because sometimes you'll say, "Oh, I'm tired of feeling a bit shit. I better get down to the gym," and then or you do something that makes you happy, and then you go back down, and then you come up, then you go back down, and then you come up, and then you stay high long enough to think, actually, I want to get on the phone and find a counsellor. So I had a chat with 2 or 3 different counsellors, I think 2. I went for one session and I just didn't connect, and then went for another session. I was quite lucky I found her, so she was really good. And then I had that counselling. I didn't have it for a long time.
Okay.
In fact, she said to me after 6 weeks, I think you're good. I don't think you need any more sessions.
Wow. Okay.
And I was like, I kind of like coming here. Can I come back? 'Cause I think you're okay.
Just talking to that point there,
Yeah.
because again, there is a taboo associated with counseling, therapy, all these words.
Yeah.
So when you said you kind of enjoyed it, what is it about the process of counseling that you found benefit from?
Once you can get to trust your therapist or your counselor, you get to a point where you can say what you want and not be judged. So I went to fucking town on everyone in my family.
Okay.
Everyone that was doing my head in. Because that's my, because families do. They annoy you. You love them. But
there's concern, but it's wrapped in all these other labels. Isn't it?
and the reason you want to go to counselling is because you don't want to do something to your loved ones that you're going to regret. That's what counselling is, right? Because what's going to happen is that eventually you're going to tell everybody to get lost. You're going to tell everyone to go away. I don't want to talk to any of you anymore. And you're going to, you're going to say, I don't want to deal
sever
with
these
it.
ties.
And that's a bad thing. So the point of counselling isn't to, and I think this might be a stigma in our community. The point of counselling isn't for you to have some epiphany that you need to leave your family. The point of counselling is to go and find a way to make things better for you, make your brain and mind and body healthier, so you can then deal with those issues in your way. The counsellor is never going to tell you this is what you should say to your loved ones. The counsellor is going to say, what do you do to make you? I'm not talking about them. I'm not talking, and that used to be the case. I don't know. I won't mention any family members at all, but my so and so did this. I fucking hate them. And she said, well, forget them. Let's talk about you.
Okay, so you gained
that was what it's about.
Clarity on your thoughts, and you kind of not closure, but I think clarity is a good word. Would you say that? Is it somebody giving you objectivity on what you're thinking, and then you thinking out loud kind of thing, and then thinking?
I was very angry at that time.
Okay.
I was just angry at the world, and it's easy to go into that place. It's one of the easiest pits to fall down when things aren't going your way, just to be angry at everything.
Right.
Everything just pisses you off. And it's about, and the whole point of counselling is to say that, that's just trying to find the best way to explain it. It's not about the world, it's about how you perceive the world. You're perceiving it.
But you have to be ready to hear that, because
this happened to make you angry. No, that's not what happened. This happened, and you're angry because it happened. They didn't do it to you. They didn't do it to you. It's about how you perceive the world. So, like I said, I didn't have counselling for long. It was about a month and a half. I know it was when we were living here, and then I don't know how long it was after that we thought, let's try again the IVF.
So, how many rounds of IVF is it at this point?
This is the second.
We had one. So we had one now.
Yeah.
And then we went and saw, so the doctor that we saw back when we very first started the journey, when we had our test done in Birmingham, brilliant doctor, Dr. Rajikawa. She was the head of fertility at Birmingham Women's. And we went to see her.
Okay.
Because that was it. Yes. Because we now live in Worcestershire.
Yeah, I was going to say, because you've moved, you're now eligible
suddenly
through the postcode lottery.
So, yes, 2 things happened. Firstly, we never had an NHS IVF, so clean slate. Secondly, it's gone from like having 1 cycle to 4 on the NHS.
Wow.
Yeah.
Okay. Big.
Is that because it's a more affluent area in comparison, and that's why? Is that how it's kind of distributed?
It is, yes.
CCGs have different priorities. Different spending priorities CCGs do. That's the reason why. Yeah.
And also in the UK, infertility isn't seen as a major health problem. So some CCGs, if they've got the money, that they'll
it's a nice
fund a cycle. It's a nice thing to have rather than it's important. And you can kind of see both sides of the argument, but when you're in there, it's different.
Absolutely.
So then we made an appointment with her. she had all our notes from when she saw us privately, and then she arranged a cycle for us. And this time we had a much better team of doctors around us, a much better.
They were really good.
And also it was Birmingham Women's. You know, it's renowned for just being an amazing hospital for women's. And then we had, I'm trying to think, we had one cycle, and it was easier in terms of we dealt with it better. We still had to do the same injections. You know, we still had to do, everything was to time. You know, had to time the injections. There was heparin. There was this injection. There were other injections. There was, you know, all the other medication that you had to take at the same time. So there was going toing and froing back and forth from Worcester to where is it? It's Edgbaston, isn't it, more or less? So the journey was easier. The doctors were nicer. It didn't work, but we didn't feel so
bad or
emotionally
like judged for it or
exhausted.
anything.
The management of your expectations was different for this cycle, or is just the fact that you're such a great team that made it easier?
Combination of a few things. So Gibson had his counselling, which also helped. I had done a lot of work on myself in terms of my self-talk, my mental attitude, building resilience, and my faith was a big part of this in terms of our journey. And there's this phrase that I was really latched onto that really helped me to get through was that Guru kade mana nahi karta. Whatever he does, whatever happens, it's because there's an intention behind it. You just don't know about it at that point in time. Or in an English way of saying it, the universe only sends you what you can handle. If you couldn't handle it, you wouldn't get sent it. And those two things were the key drivers in how I got through it myself. Was this was all intended for me. This is my journey. I'm going through this because I can handle this, because this is what was destined for me. And I don't know what's going to be the outcome, but there's a reason for this. And I kind of let that free flow a bit more. It was still difficult, but I just found that an easier thing to cope with from a faith point of view. And that was, you know, like our faith, there's a bit later on that we'll talk to her about stuff that we did, had a major impact on my mental ability to help them cope with this. I'm a big believer of that, for sure.
And I'll talk to Karan quite closely because he's more sicky than I am. But I think Mum helped a lot with that as well, I assume.
Massively. So my mum is amazing.
And Nanny as well, yeah.
Yeah, my mum is amazing.
Lots of part and Ardasa and
absolutely they were. And then also, as we were doing these cycles on the NHS, we were seeing a reflexologist at the same time as well.
Okay.
So
what's reflexology?
She was
Andrea.
Yes.
Actually, she's really key to this. So
she's really key to this. So this was just after Balki got married. My Bobby's family, somebody in there, they were also trying to get pregnant as well. And you know how the mums start talking, start sharing, how many years has it been? They start, sharing life experiences. And then it transpired that they were going to go into somebody in Derby or Leicester, I think Leicestershire it was, who is a specialist in fertility as you're going through IVF journey. And she helped like reflexology wise, a bit of spiritual kind of stuff. Some would call it woo-woo, whatever you want to call it is what you want to call it, which is totally fine. She was spiritual to a different kind of a level kind of thing. So we went to go and see her in parallel to our IVF cycles, and also in between as well. She would see me and she saw Dips actually. She saw both of us as separate clients. So we spent quite a few months during Spain seeing her, and she was almost like a fertility coach, like a fertility life coach, because she was there holding our hand from a personal and a emotional level that I didn't have from anywhere else. So I felt it easier to talk to her and explain to her, because she's been through with the couples as well, but she would also give tips, advice, just listened. And I felt like somebody else had my back, not just, the mums and stuff, but somebody who was independent
Yeah.
a bit like a counselor, I guess, to a degree. And I found it really easy to talk to her. And she had, I'm trying to find a way to describe this, which is not going to make me sound like I'm a freaking lunatic. She had sixth sense kind of intuition abilities. Yes. That some people buy into, some people don't. I was very bought into it. I'm like, yeah, this sounds good. Tell me more. If it means I'm going to get pregnant, this is really great. And I found that really helpful as well, because it felt like she had our backs, and she'd been through IVF so many times with so many other couples, especially in the Asian community. And she would say the things that I see in the Asian community with these poor girls under pressure, mothers-in-law giving them advice, telling them what they can and can't eat, telling them what they should be doing. Are you pregnant? I don't know how you poor girls cope in your communities. I'm just like, yeah, I understand that. That insight was fascinating. I forgot about Andrea until this, and actually she was a major part of our journey.
Do you believe in that stuff, Raj? Or did you think it was all like, ooh. Come on, man. I have to ask your perspective, Anna, because you're on the same pathway.
No, I didn't believe in it.
Yeah.
On the mental coaching side, and just having, I think for Harps, the way I saw it is it's just nice for her to have someone who's been through it, who's a woman who understands it, because I don't know women's bodies. You know how they are biology wise, but you don't understand the emotions. Yeah, exactly. So Andrew, you say to me, do you want reflexology? And I was like, yeah, you're right.
What actually is it? Is there like anything you got to
reflexology is so the idea of reflexology is math. So the theory is that every part of the body is connected, represented is a better word, in your feet. So you can massage certain parts of your feet to reach certain parts of the body. If you get headaches, you can massage a certain part of the foot and it will help as well. And it's a really ancient tradition. I think Chinese and Indian culture do rely on it really heavily. And they put a lot of faith in it as well. And I'm absolutely sure there's something to it. But yeah, because otherwise it's been going for hundreds of years. I'm sure some people get benefit of it as well. But it wasn't for me. And that was okay. So I mean, so Andrea, afterwards, we used to go to a house first, and I just used to sit downstairs in the sofa
watching TV. Football like oh, beer
yeah, if Liverpool won, my sperm count would go up. If not,
I'm ready.
Let's go. So
Kaam, Karla. I knew that phrase would come back. I knew it would come back. Right?
No, Dips at the top that says, "My proper jata."
Dear Lord.
Oh, I've got so many dirty thoughts going on. But anyway. So I mean, but I was as much as I could. I mean, I think I was fairly respectful of everything as well that she did. It wasn't for me to shit on anyone's beliefs or anything like that at all as well. But I didn't believe it, and I couldn't wholeheartedly say yes. It's going to work for me. But this, from what I thought, this wasn't about me. Wasn't about for my body.
Yeah, exactly. That's the way I approach it.
It made, compared to all the other shit that first doctor went through, and then all the difficulties with going back and forth from Sheffield, although she was a really nice Chinese doctor. Harps really connected with Andrea, and I was happy for her to go. And it was in I want to say Bolton. It wasn't Bolton. It began with a B.
No, it was
Bournemouth.
It was just outside Derbyshire.
Place near Derby that begins with B.
Bury?
No. It probably doesn't even begin with B now. Thinking about it. But anyway, it was in Derby. It wasn't very far. It was half an hour away from us while we were living in.
It was about an hour away, Dippage.
Okay. Well, I didn't believe in it anyway. So that was really great. So, and she'd get Harps mentally and emotionally and physically ready each time we did an IVF cycle. So anyway, we did the first cycle. It didn't work.
Right.
And then the great thing was we'd have a sit, and it's pretty much the same thing that went wrong as the first cycle, in that there was hyperstimulation, had a large number of eggs. They weren't great quality. They said, look, after, so you get, what happens is you get a number of eggs, let's say 20. Naturally, some of them are going to disintegrate. Then you'll get like 5 or 6, ideally about 10. Viable. You would try and fertilize them with my sperm, and then you'd wait and see which ones form a blastocyst. And then you'd implant that. Well, none of them form blastocysts.
Okay.
So then we had a sit down.
Nothing to implant.
Basically, yes. And then, and the great thing is we had a sit down with the doctor afterwards, and she said, look, let's try this, this, and this. Next time,
medication dosage. That was a big thing, wasn't it?
So she was thinking about it like a scientist.
Yeah.
Rather than, well, have you eaten too many peas? Was that
so getting more practical about it? Yeah.
Don't blame me. This is me being angry. Don't blame me. For your science not working.
Yeah, just the methodology. Exactly.
Or for your treatment not working. So anyway, so she was brilliant. So she sat down, we had a look at that as well. And I think, and I don't know what happened next.
So what happened next was that's when I had my hyperstimulation.
Was that when you ended up in hospital?
Yes, second round was hyperstimulation. So OHSS got, so they changed the dose of our medication, and they gave, I can't remember if they gave more or less. I don't remember what they did. Had another round, maybe like a month or 2 later. It was pretty back to back. They were like, we know your cycle now, when we're going to get going with this. So I had egg retrieval. And then I remember we went out for dinner with some friends that evening or the evening after. And I felt really bloated. And I was like, God, I feel really bloated. I couldn't really wear anything that was really comfortable. I couldn't really work out. I just thought just a reaction to the medication that I had. I've been under sedation or whatever. Fine, whatever. I'll just wear a different dress. And throughout the evening, my stomach got bigger and bigger. And I just couldn't work out. I just thought I was eating too much. I just couldn't really eat. I felt really unwell. And then they gave us a phone number on the aftercare sheet. These are the symptoms to look out for. We got home that evening and I was just like, fuck, I've got these symptoms. I'm bloating big time. I'm retaining too much water. So I called the nurse, 24-hour hotline it was. I called her, spoke to her, and I told her this is what's going on. NHS, this was. And she said, pack a bag, get to the hospital now. And I was like, oh, okay. Got there, presented, and they were quick. They were on it. They're like, this is really serious. We've got to get you on saline. We've got to get you assessed. We're going to keep you in overnight. You can't go home. And I didn't really get the gravity of the whole thing. I didn't really understand. I didn't really get it. Then the same doctor who'd been seeing was on ward rounds the next day. She came to visit me on the ward rounds, which was really unusual because she's the head of the Fertility Centre. Came to come visit, and she's just like, I'm really sorry this happened to you. I didn't realize you were going to react in such a way. And I was like, oh, I'm really sorry for the reaction. And she's like, no, Harpreet, this was a really big deal. This is life-threatening. And I was like, oh, really? Didn't really get it. I just didn't really register what had happened. So she took it really seriously. And we had amazing care with the NHS. And
what actually happened?
My body reacted in a OHSS, ovarian hyperstimulation syndrome. That my body reacted to the medication, overreacted, and it went into overdrive. And I was retaining too much water, and I was swelling up with it, basically. The swelling was dangerous if left untreated. Ikmin, Google karse. OHSS. And
I'm not going to profess to know what that is.
Even though Karan's a doctor, he doesn't know everything.
Ovarian hyperstimulation. Exaggerated response to excess hormones, usually because women take injections to stimulate the ovaries. Ovaries become swollen and painful. Severe cases may require hospitalization and additional treatment. So there you go.
So you were on a drip, I guess.
Hospital for a few days.
What's that?
I didn't know this, FYI. So in case people are thinking, didn't you know? No, I had no idea. All right.
In case people think Indy didn't care.
Yeah.
That was
I
cycle number
wasn't
2.
told.
Then we had one more cycle.
Well,
So
no,
then
but
we go on.
she was it that cycle or the next cycle that she just wrote off?
No, we had one more cycle because on the 3rd cycle, I said to her, I'm reacting in a hyperstimulating way, in PCOS way. I'm reacting in a PCOS manner. Why don't you treat me as if I got PCOS, polycystic ovaries, and why don't you give me metformin? And she goes, that's a good idea. I'll give you metformin. So I said to her, look, I'm reacting in a major way. And but apparently, according to you guys, I haven't got PCOS.
Right.
The polycystic ovaries is a condition that a lot of women have. May not know that they've got it because there are different stages. There's different levels of PCOS. And I never had any severe symptoms of it. So mega symptoms are women who have excess hair, who are overweight, find it hard to lose the weight, irregular periods. I could plan a holiday around my periods. I knew 28 days, militant cycle. It was, proper on it. There was never any issues with that. Well, I haven't got PCOS, have I, doctor? No, you haven't got any of that at all. Okay. Metformin. This is our last chance saloon now. Metformin, we did it. Did the metformin. And
What does
3rd
metformin
cycle
do? Sorry, for those who don't understand.
Helps to regulate the PCOS symptoms that you might have. You give it to diabetics. I don't remember why it works in PCOS patients. I don't remember why. You tell me, doctor.
I actually don't know. I know why it works in diabetics, but not in PCOS.
Anyway, so that's the thing that often happens. 3rd cycle didn't work.
Okay.
And then we're like, okay, that's it. This cycle hasn't worked now. Had our review, and then go on, David. What did she say next then? I said to her, what about egg donation? I remember saying to her, clearly my eggs are duff. And she said, yes. What about egg donation? She goes, I'm very glad you brought that up. Here's a leaflet. Now I'm like, okay. These
So
are the
another
next steps that we
egg,
can look
but
into.
dips a sperm, but the implantation would still be in yourself.
So egg donation means that you would get the egg donated by a third party, and we'd use that, and then my sperm and implantation, and then pregnancy, hopefully.
Okay.
And so she gave us a leaflet, had a look at it, and then so egg donation in the UK is basically, there's a register of egg donors and sperm donors as well. So once the child gets old enough, I think 18, they're allowed to request, where are my eggs donated from? And they're allowed to get in contact with that person.
Yeah. Okay.
Because of that, very few people want to donate their eggs. Because, you
no
can
one wants
understand
someone rocking at the door.
Yeah.
20 years later.
Sorry, I
Your son.
misinterpreted. I thought it was the opposite way around, where it's like the donor is legally able to speak to their child.
The
Right.
child
It's the
can
child.
find the donor.
Yeah.
Right.
Child knocks on donor's door. Hi, I'm your son. No, you're not. I did a donation of some sperm. You're not my son.
And so because of that, there are very few donors in the UK.
And even fewer Asian donors.
And even fewer Asian donors. And you can understand why, right? Because you can see how that path leads. And so we had a chat with her because, look, there's a list of donors in the UK on the NHS. It's a long list. Don't know how long you'll be waiting.
What's on the list in terms of details? Is it like gender,
in order for us to...
Not gender, but ethnicity.
Egg donation usually comes about when women are going through IVF. They have a successful cycle. They have leftover eggs. And then they get asked, do you want to donate them? And then they say, yes, I want to donate them. Well, no, I don't want to donate them. So it's a long waiting list because some women don't want to donate them for all these reasons, for whatever reasons. And then there's a shortage of also Asian donors in the UK, compounded also by the fact that you can be, found in 18 years' time.
Yeah.
So it was an 18-month waiting list in the UK. And it had to be specifically Asian egg donors because we can't have children that have got blonde hair and blue eyes as Asian parents. They have to, the child has to look like part of the community and part of the family. That's a really big criteria that they're really strict about that.
So she
really,
said,
is that a thing that they say? So they say, even though you got this long list, you can't have.
Oh, sorry, that wasn't your
ethnicity.
criteria. That was their criteria.
That's their criteria. I didn't know
because
that either.
otherwise the child doesn't fit in. How do you explain to a child, a biological child, that you had blonde hair, blue eyes? How does that work then? So it's really important for the child's sense of self that they fit in and they look like their parents in their community, which actually makes a lot of sense.
You know, in that scenario, you talked about the 18-year rule. So is there a mandatory requirement for the parents then to tell the child this is where you come from? Otherwise, they wouldn't know, would they? Or
No.
How do they know to then go and ask?
Up to the parents to tell them in the first place. If they want to search for it, I think it's HFEA, keep a register.
Yeah, that's it.
Human fertilization. Yeah, HFEA, they keep a register, so you can contact them.
So the very same doctor said, look, there's a clinic in Spain. They're Europe renowned.
Oh my God,
yeah.
wow.
I have personally been to vet them, is what she told them, and they're really good.
Yeah.
So we said, fine, okay, let's have their number. So we called them, and we told them, what was going on, and they invited us for a consultation to Barcelona. Okay. And then we packed our bags, went to Barcelona. This would have been this was late 2013 now, just in interest of time.
Yeah.
No, it wasn't. It was 2014. It was early 2014.
No,
because we went to Canada first, then we went to India, and then we had our consultation in Barcelona in April.
I thought the treatment was around then. Our initial conversation. So we went to Barcelona 2 or 3 times. Anyway, it doesn't matter, does it really?
We went twice. No, we went twice. It was April, and then we had
these Kerals, man.
When were these kids born again?
They always have to be right.
When were they born? When were your kids' birthdays?
You've spoiled it. You've given away the ending of our journey. What the hell, man?
Right, okay.
2014 it was. 2014. Okay, so we called in January, and then we had an appointment in April. And I was like, shit, 3.5 months is a long time. So we said, you know what? Let's do stuff. This is going to be a big thing for us. Let's go and do what we want to do for ourselves. We've got a 3-month gap.
Okay.
No one's doing any
bucket list style stuff.
Yeah.
Yeah. Okay.
So we went to Canada in February to see the Northern Lights. We went to the Yukon in Canada, which is 1,000 miles south of the Arctic Circle, to see the Northern Lights. Average temperature was about -38. And we saw the Northern Lights, and we'd been setting with huskies, and we did ice fishing and snowshoeing and all that kind of stuff. I got pneumonia, doesn't matter, that's a side thing. I was dying in bed. He's like, you're all right, man, let's go out. Yeah, he's like, you're okay, it's fine. I'm like, no, I feel really unwell. You're okay, just lie down in your bed. I'm like, no, I feel really unwell. And I was like, oh, pneumonia, thanks.
Kangi, I thought you'll be fine, don't worry.
You like, let me throw reflexology card.
Where's Andrea now, eh? So I remember it as being go sooner, but yeah, you're right. So we thought before we do this, we had a chat, and I think we thought this is going to be let's do a big holiday because all these 3 cycles we had with the women's were big. They were a big part of our life, and they took
were they in close succession as well?
And pretty much. They were like, take a break, have a period, come back, fine, okay. Right. I think also one of them failed very, very early. And the doctor was good enough to say, we'll just pretend that one didn't happen.
Oh, wow.
Yeah. She's like, yeah, we're right that way. Look, technically, you didn't really have a full cycle, so we want that to happen. So we ended up having 4 rather than 3. And then she told us about this clinic. We said, fine, let's go to this clinic.
You missed that India, did you?
I'm getting to it. And the reason Europe was attractive was that they don't have a register of the donors, and it's not like we have a problem with the kids tracking them down, because in ours we're still our parents. The waiting list and the abundance of donors was greater. So then we thought, okay, fine,
and they look like us. So a lot of Asians go to Spain and Greece because we have Mediterranean skin tones.
Well,
so because the children will then look like your parents. So they said Spain or Greece, which one? At that time, Greece was going through the financial crisis.
Not
going to Greece. They'll do a running with our money. Let's go to Spain. That was what the criteria was.
So we thought, okay, so we had. I think we were really feeling quite hopeful for it. I don't know whether I'm misremembering it, but we were anyway.
No, you're not.
And we thought, let's do a big holiday. We wanted to go and see the Northern Lights. We went and they said, look, why don't you go to Canada? You could do all this other stuff as well. So we went to Canada for, I think it was 10 days in total, went to see your family. And you're right, we went to the Yukon, which by the way is beautiful. Everyone should go there. And then we went to, and then we came back for like a week or so, and then we packed our bags and we went to India. And we spent a week, and I said to my mum and your mum and dad, we're seeing no one.
Yeah.
We're staying at Harmandir Sahib in a hotel.
Okay.
And we're just staying there for, how long did we stay there? A week? 6 days?
A week. We did a week there.
And we just did a week of Seva, pure Seva.
So every day, Harmandir Sahib.
Every day, yeah. Every day we'd wake up, we'd do Bart in the morning in the hotel. So you'd get up Amrit Vela, so you can hear everything coming from the Golden Temple. And it was just beautiful. We'd just walk, because there was a new hotel open there, Jury's Inn or something like that, Radisson. And we just walk across the road. It's 5-10 minute walk. Walk there, spend all day there, and then come back at the end in the evening. And that's all we did for 10 days. Yeah. And that was.
And when you were there, so obviously there are different things, things at play here, and that's obviously a very spiritual angle. Was your binti, please can we have a baby, or is it more help us understand your hukam, whatever's going to happen is going to happen? What is it were you asking for it, or were you just asking to understand?
It was asking with our entire heart. We've been through all of this. Help us to have the one thing we really want to have. And it was just the constant thing. That was the whole thing, was I'm come to you with my head on my hand, and I'm asking you to help us on this one thing. I'm taking one step to you. Now can you give us what we're asking for? And the way that we heard the bath, and Mum was there as well towards the end of it. She came for the last 3 or 4 days. As we were leaving, she arrived. We and like we just went to listen to, we worked in the kitchens just like most of the day. And I know we probably shouldn't tell the story, because we're probably undoing all the same that we did for our soul, because it should be between us and the soul. But I think people need to understand the element of the spiritual side of this at the same time as well. That was a really big thing for us, that we were able to spend that time. There was no pressure, there was no fucking shopping. There was no going to somebody's other thing or this person's house. We went to, none of that. We saw your mama, Dip's mama, for half a day, and they were like, why are you not staying here? And we're like, we just want to be there. And they're like, why are you not staying here? We just want to be there. And that was it. This is about us. It's not about you guys. And that was a really big deal for us. And something to me, it felt like it's our turn for a miracle. All you hear about when people go to Harmandir Sahib is they have their miracles, because they go with a complete open heart. And I just felt like it's time for us to have our miracle.
So those 10 days for you were transformation?
They were a big deal to us. They were massive to us. The hope and the love, and just when you walk around and the screens are up and you can read the translation and you can see what's going on and you can hear what kirtan it is. Hukamnamas and the kirtans, and what's that kirtan they do early in Harmandir Sahib at 5 p.m. in the evening. There's one particular one they do, and they sing it, and it's Aarti. They do the Aarti. And I really, really love hearing it, because I love reading what it's asking for, because the Aarti is a benti, and it's, give me this many horses, give me this many cattle, give me this, and, and I'm all yours. And I remember thinking and reading it, thinking, this is just phenomenal. And I just love the purity and the bliss when you hear the Aarti. And to this day, when I hear Aarti, it takes me back to being back then.
Yeah,
and I only hear Aarti when I'm in Harmandir Sahib. I don't hear it any of the time, only in Harmandir Sahib that I hear Aarti.
Or a little side thing. If you've got Spotify, guys, Sartaj has a beautiful Aarti that my wife introduced me to, that we listen to now constantly.
Send me the link. That sounds amazing.
Send me the link as well, Karla.
I'll send it for you, no problem. That's fine.
And then, so when you listen to it, have the translation at the same time as well, Indy, because then you can then understand what it means, you connect with it more, and you understand why it's so. It's stunning. And I think they have it on, what's that Sikh program that Mom used to watch, that Sikh channel? They put it up on there as well.
It's on the
Is
Seek
it
channel.
STC
That Seek
or-
program, the only
or
Seek
Seek?
channel available on the whole of Sky. Yeah, that one. Yeah.
Oh, no. Obviously, I don't watch it, do I?
There's a couple more now. They're up, yeah.
So yeah,
Right.
so RT was a big thing. So
Mm,
that for us was a really big deal.
10 days of
And I just
bliss
felt like-
and Anand
Brilliant. Just brilliant.
Okay. So you've done that. You've been to India.
Yeah.
And then what happens after? So you come to
Went
England
to
and then you go to
Barcelona.
Europe?
Yeah, I went to Barcelona in April. We were in
Mhm.
India in February. And yeah, went to
So,
didn't
yeah,
we
so-
go and meet? Didn't we go and see a Baba in India as well?
Oh yeah, that was all fun, wasn't it?
What happened
There was
there?
that when we went to India before
Are you,
as well.
are you talking about the same one or a different one?
I don't remember which one we're talking about.
India was that part of India was phenomenal. The thing is about the Seva. I remember the Seva very specifically, and this is going to sound really weird, but I wanted my body to hurt after the Seva because that's how I felt my body was gonna. That's the only way I thought I'd have done decent Seva.
Like you put a shift in. Yeah.
Yeah, basically, I wanted to feel
Basically,
like
yeah.
I'd done manual work, and
Yeah.
and we did. So we spent one day in the kitchen just washing pots and pans at Harmandir Sahib, and my
Every day, didn't it?
this is the last day, and so I don't know if you've ever been and seen how everything is washed. Everything, so you get the thal, it's dipped in, it's rinsed off, then someone washes it, and someone washes it again. And I think someone washes it again before it's clean. And we're just constantly cleaning. And some guy was throwing thals back and saying, still not clean, it's still not clean, it's still not clean.
UK वाले बंदे आके ना सारे
And I was getting so angry because he just kept dumping them back. But it's
The test.
it was a test. And then in the morning, we went there really early one morning, and I said, I want to pick up
Bulky.
the bulky in the morning.
What does that
When
mean?
they take it, the Guru Granth Sahib is put on.
Yeah.
the Sukhasana.
Yeah. It's carried on. I don't know what the word is. It is bulky, isn't it?
It's like a
You
palanquin. Carried on a palanquin.
Palanquin, yeah. But
Yeah,
you carry it on your shoulders, and and probably 20, 30 men are carrying it across that
'Cause it's
walkway
that
into
heavy,
Harmandir
yeah.
Sahib, and you can still feel. I had bruises on my shoulder. You can still feel how heavy it is. It's unbelievably heavy.
Men only. Women can't take
Yeah,
part.
it is Ben. It's Ben. And it was it was brilliant. It was really spiritual. And
So you
There was
carried
that
it.
guy.
yeah, I
Managed to
did.
carry
Yeah,
it. Nice.
Yeah,
Okay,
yeah. So
He
I
got
was
to carry
there. I wanted to do it, and it was more or less the last night. It wasn't quite. And I said to Hops, I don't know where to go to do it, because usually your dad's there to show us what to do, but he wasn't there. And then I was sat there thinking, how do
So
I-
difficult. Yeah.
I was
sorry.
sat there thinking, what do I do this? And then this guy comes up to me, and this guy was deaf and mute, so he couldn't talk. And he made signals, and he goes, he started pointing that way, and I got the gist of what he was saying. And I was like, well, yes, I want to carry it. And he goes, well, go over there. And I went over there, and I got to do it. And then I looked around, and then the guy had vanished. He wasn't there anymore. Couldn't find him. I was like, that's got to be some sort of sign somewhere, right? And I'm not spiritual,
As you can tell from
yeah.
the reflexology area, but yeah.
And I'm not. But there was something in there, and there is a power over there, and it got through us. It got us through that tough time. And I think this is why we felt so much lightness when we went through this journey, this part of the journey. It felt much easier. So
We also been through it like for 6 years by this time.
Okay.
Yeah,
So
so
6 years up to now.
yeah,
Wow.
we'd grown as people, and a couple at the same time as well, and we'd been through everything. And this was, this was. I think there's an acceptance that this is just your life. Accept it or be damned. So so my body hurt that day, and it felt brilliant. Like you proper, just like you put a proper
No gym
manual shift
workout
in.
come close to it, yeah.
No, I'm sure you could feel more sore by lifting very heavy weights. Didn't feel as good on the inside though.
Yeah.
Didn't feel as good on the inside. Then we left, came home, sorted our business out, And then we went back to Barcelona. Now in Barcelona and in Europe, the thing is that they treat fertility much more aggressively, like it's a health problem, than they do in the UK.
Right.
Wow.
So already we were on a better standing. The clinic was well renowned. The doctor, first name was Gemma, she was brilliant. And she was just said to Harps, look, we're just going to treat you as if you do have PCOS.
Well, hang on, she did a scan on me and
She
did a
did.
scan, and she just goes, oh, you've got PCOS. I said, no, I haven't. I've had loads of these scans. I'm a pro at this, love. I haven't got PCOS. She said, look, let me show it to you. And she showed me that I had ovarian cyst. I had ovarian, so on your, when you have an ovary, and the ovary will produce follicles. The follicles traditionally sit in the middle of the ovary. When you have PCOS, the follicles sit on the circumference, sit on the outside of it. And she goes, this ovary here, that is a PCOS ovary. And I remember being so angry, just thinking, if we had known that and that had been picked up, we could have treated me differently in a completely different way. And I was so annoyed that she picked it up in a 2-hour consultation that hadn't been picked up by anybody else before.
Aren't they called something?
Having
Isn't there a special word for those cysts?
Polycystic ovaries.
They weren't cysts. Yeah, I had polycystic ovaries, but the way they were sitting, she goes, that's a PCOS ovary. This is why I have difficulty conceiving. She goes, you know, your difficulty conceiving isn't because of your translocation, it's because of this.
Right.
Fucking hell.
Wow.
That was a
Okay.
big deal. That was a really big deal. And that made me really angry at the system and frustrated. Then I'm like, okay, you know what? I can't change the past. What's happened has happened. This has been my journey so far. What are the solutions? This was an hour and a half, 2-hour consultation. You know, she listened and she made notes and she asked good questions, and we felt really like we'd been listened to as a couple, and our wishes been respected, and explained how it all worked. Egg donation, this is what it's going to work, this is what it's going to do, this is the costing. It was a business, a full-on business, but with empathy, which is what you want.
Wow. Okay.
These
Best of both
guys are
worlds.
pros. People come from all over Europe because they're one of the biggest egg banks in the world.
But
Was
by
in
the way,
Barcelona.
we got a discount because we were part of the EU.
Pre-Brexit.
Are you
Yes.
serious?
Yeah.
Oh my days.
Fair enough. Isn't it?
About 30%
Remember that? You
off.
remember the most random shit, honestly.
Yeah.
Oh man, someone
guys,
should have
just
put
to
that
give-
on the
just to
fucking
give
side of a bus,
people-
right?
An idea. It's 6 years in at this point. Circa, how much have you spent to this point?
Well, we had
Our
all those.
first
We had all those
cycle.
cycles on the NHS, so we were quite lucky. So our first consultation, where we had the NHS, we had those private tests very first, £300-400. The cycle we had in Nottingham, £6,000 ish.
6 to 8. Yeah.
Then you've had a
And
year
then-
of acupuncture, reflexology. So ballpark. what
All
would you say,
those
like,
appointments, 50,
And then-
60 quid each time.
Okay.
Times that by 4, 250 a month. Times that by 12, 3-4
by 10.
grand. Yeah. So
And
you
then
know,
this cycle in Barcelona was about £6,000. You know, plus
no, it was
Okay.
no different. It was between 8 and 10 this grand, this cycle.
a discount.
Obviously, I was the one doing the finances here. Can you tell? I'm the one
Discount.
sending the money
Do you
across.
mean you do remember the discount? You do, yeah. You do remember the discount. So I reckon in the 20-25,000 pound, you know, traveling to Barcelona, hotel stays and that sort of stuff as well. But we
That
didn't. I
wasn't
mean,
part of the 20 grand. Okay, fine.
but you know, but I mean, it did cost that. We were lucky that we could afford it. We were lucky that the cost was spread out, wasn't all in one go.
Yeah.
But also, you know, how much do kids cost over their lifetime? They're a lot of money, and this was but a drop in the ocean compared to all that.
Yeah, that's true.
You know, all that as well. So so we'd spent a lot of money. It's a shame it didn't work through the NHS, but the NHS did help us a lot on the way, because if it was for that, another 3 cycles privately would have cost, it was 4 cycles, would have cost another 40 grand. So PCOS, they treated it as PCOS. They gave us the drugs to go home with, and then the injection started again, and then and it was a strange time because we didn't really hear from the hospital.
So
They
what happened was,
got in contact with regarding the looks of the donor.
yeah, so what happened was after we left, we came back home, I'd send a bunch of photos of myself because they use Dipsis sperm, but they're going to match the donor to me.
Yeah.
And they matched the donor to me. So they made a big deal about this. And this was like next level impressive. So match up to my height, my weight. Yeah, okay, fine. Hair color, eye color. Yeah, obvious. Down to the shade of eyes that you have. Is it light brown, dark brown, hazel? And your hair type, is it straight, wavy, curly, afro? What kind of hair type do you have?
Wow.
And you know, they wanted angles of me of my face in different angles, 6 to 8 photos in different types, different photos, so they could really match as close as they possibly could, which I thought was okay. This is pretty good. And then things went quiet over the summer. And they all closed down for August because everywhere in Spain just shuts for August for like
Siesta,
national
isn't
holiday.
it? That's weird. Yeah.
Yeah, well, they just close and everyone just goes on holiday for 4 weeks. We didn't really hear much from them. So I kept asking them, have they got a donor yet? Have they got a donor yet? I haven't really heard anything. September comes along and they're like, right, got a donor, done everything, you need to come to Spain. And we're like, what?
By the way,
during the
just
summer,
just to interject, when they find a donor, they never use that donor again.
yes.
Whoa.
Yeah.
Donors are often uni students
Because they get paid.
because they get paid. They used to
Holy
get paid about
shit.
1,200
It's a
euros.
proper
They get paid.
business.
Yeah, they get paid 1,200 euros to donate your eggs.
Well,
And they go through IVF cycle.
This is what I mean by them treating it much more aggressively. Yeah, absolutely, it's a business, and you know, why should we begrudge anyone making money, as long as it's done ethically and properly? But they do. They treat it much more aggressively.
Okay.
So then they said, right, got a donor. Okay, great. We've done the cycle during the summer. Oh, thanks for telling me that. They didn't tell me that bit. Everything ready to go. When your next period's going to happen, these are the dates you need to come. You need to come to Spain on these dates in October. I was like, oh, damn, that's happened really fast. We didn't expect any of that to happen.
So it was also one more thing, because they weren't getting the eggs from you, the drugs you had to take weren't as intensive.
Oh,
yes, that's also a good point.
Yep.
I had to prep myself to go through to get my body ready as if I was going to get pregnant.
Yeah, to
So
receive.
yeah, so I had to have hormones and stuff to prep me for pregnancy. So my body was ready because my body needs to think that I'm already pregnant, or to get me ready for pregnancy if I'm already going through that. Yeah. So then we went, and the day before we went, we got a phone call from the clinic, and they said, we're really sorry, it hasn't worked. And we're like, what? They're like, we're really sorry, it hasn't worked. We can't explain the reasons why, but the blastocysts aren't developing like they should be developing. We're not sure if you should be coming or not. We'll let you know tomorrow. And we're just like, what the hell? This was a massive mind fuck. Like, we were really close, we were really high, and then suddenly like, oh God, then what? They made a phone call from them the next day, and they're like, we don't know what happened, but overnight things have massively caught up. You can come. And we're like, okay, right, we're off. We're going.
This is the difference of one night. That's your kid, Palmer. I mean, that's
you know, you don't know why, right? You just don't know why. And on the day that we got that phone call, it was Purimashi.
Okay.
And when we went to Barcelona to have our assessment, it was Purimashi then as well. I remember we were talking about it being Purimashi.
It was.
And yeah, it was Purimashi then. So when I had my transfer, it was Purimashi. Something like, it was Purimashi for like a day or two. I remember that was a really big thing. That was part of something that we talked about a lot as well. It was about it being a new month and what that meant for us and stuff. So that was, I can't remember much about that. Then we went to Spain, went and had the consultation and stuff. So when you have embryo transfer, so when the embryo transfer, this is all being done to me. You have to have a full bladder when you're having it done, so that they can locate where they're going to be. So imagine when you're having embryo transfer, the annotation is you're going to be putting a grain of rice in a jam sandwich. That's how you describe it, and that's actually a good way to describe it. That's what it's going to be like.
Okay.
Yeah. So because you see the pictures, and the uterus looks like this. There's this big vest, this big gap, this image of this thing just floating around, like, you know, it has it latched onto something. He's like, it's not like that, you know. It's like you're going to do a jam sandwich. You're going to place it into there. But you need a full bladder for the scans as they're doing the actual procedure. But okay, fine. Things started running behind. I still had a full bladder. I meant to be a full bladder for half an hour. 2.5 hours later, it was still waiting. And I can't go for a piss. And I'm just like, oh my God, I'm bursting. So we went into the procedure, into the operating table. My legs are in stirrups and stuff. Back to the procedure. And she said, I'm going to put in 2 embryos to increase the chance of uptake. Do you agree? I said, do what the hell you want. I just need to go for a piss. I don't care what you do. Just do what you gotta do. I'm just like, I know it is. Just do what you gotta do, man. I was scared that I was going to like wee in her face because she's like digging in, doing all this. I'm just like, oh my God, please don't. Oh my God, please don't. Oh my God, please don't. It was just mortifying. Dip's sitting next to me, holding my hand. And I was like, okay, just talk to me, talk about what's going on, tell me other things, take my mind off what's going on in the procedure. And I said, okay, how long have I got to lie down for after this has been done? And she goes, 10 minutes. I'm like, okay, fine. And I go for a wee after that. She goes, yes, you can. Those were the longest 10 minutes of my life. I said to Dips, put a timer on your phone. I said, put a timer on your phone. Like we had our own like ensuite room. There's a bathroom, there's a loo. And
the worst thing is it's right there as well. It's just
get this ready. I'm lying down on this trolley. I'm like talking about anything for 10 minutes and then make way. I need to go for a wee. It was like the longest wee of my life. The best wee, but the longest wee of my life. And that was it. They're like, okay, you can go now. I'm like, what? Like, you can go now.
As in back to England.
Then had to stay in Barcelona for one day, for one night extra, stay overnight. We didn't really do much. We just stayed in the hotel. We just chilled, just in case any complications happened overnight. So I stayed for one night extra, and then do a pregnancy test in 2 or 3 weeks. I can't remember what it was. And we're like, okay, that was it. And you just keep on taking the hormones, doing all that kind of, doing all the drugs and stuff. And then we went to the Lake District for a holiday with some friends, the lakes, because we go there quite a lot. So we thought we'd just go have a bit of chill time before we've got any tests to do and stuff. And I had to do a pregnancy test while I was there because that was the timing worked out.
And they all knew or didn't know?
Yeah, our friends knew.
They were very close friends, so they knew the whole journey. Yeah. Incidentally, in the UK, there's a whole campaign around not implanting twins because the chances of complications are higher.
Okay.
Yeah. Big time. Yeah.
So
there's a much higher.
So she put in 2 embryos and that.
Yeah. Thinking that one would be like viable, one.
Well, increasing the chances.
Yeah.
Aren't you?
Yeah. One doesn't uptake. Yeah. So then we went to Lake District, and we did a test. I did a test, and in my heart of hearts, I knew I was pregnant because I didn't feel like I'd ever felt before. I felt different. And when you do a test, usually you pee on the stick, put the cap on, lie it on the side for like 2 to 4 minutes or something. You have to wait like a period amount of time.
Oh yeah,
I peed on the stick.
Yeah, definitely. Yeah.
So I peed on the stick. I can't put
Is
the
this
cap
what
on.
the fucking talk about? Yeah. That,
of course,
you're talking to 3 guys here as if you've done this before. And Barge, I bet you pissed on a stick before. I bet you pissed on a stick before, didn't you?
You sound like you did have. Yeah,
I was gonna ask, India.
I said the convincing thing. I was like, yeah, definitely. I'm trying to be relatable here. Right?
Have I done one? Pregnancy test?
Yes, you did. Yes, you did. You're an idiot. Yes, you did. Yeah.
Lad. He's like, मैं भी pregnant हो गया. Yeah. Proper jat.
मैं हूँ pregnant, yeah. And then so I peed on the stick. By the time I put the lid on, it said pregnant.
By the time you put, that's like instant, man.
It was instant because my hormones were through the freaking roof. Because it was twins. So I came out.
Oh wow. Oh, okay.
And I said to Dips, I'm pregnant. He's just like,
we didn't know then it was twins, by the way. Right. We just thought pregnant.
I had a feeling it was because we had 2 embryos and my hormones were through the freaking roof.
Yeah.
And I was like, I'm pregnant.
So this is you and your own in the bathroom. You come out.
Yeah.
Your friends are elsewhere in the house or something.
Our friends are downstairs.
What's the reaction now? You two in that moment. What's the reaction?
Just stunned silence.
Yeah.
What?
You're just taking it all in.
It worked. It
Yeah.
actually worked.
What have I
Were you
done?
not thinking caution
No.
because of the
No,
miscarriages
I
you
was-
guys had in the
No,
past?
A little bit, yes. But initially, it was like, this worked.
something told us this had worked. Something told us
Right,
this had
okay.
worked. Something told us this is different, whether it be our belief or powers that be, cosmic energy, and all that stuff. Something told us it worked because everything had aligned, and then we went downstairs. We told our friends because they're very close to us in the
They
UK.
knew what we were doing anyway.
And they knew straight up what we were doing, and it was that was it.
It was good.
And then
So
we
then
went.
we booked an appointment.
Yeah, so that doctor that we were seeing at Birmingham Women's, the head of fertility,
Yes.
we went to see her privately. We said, look, we've taken your advice, we've gone, it's a positive test. And she did an ultrasound and she said, oh, it's twins.
Ah,
We're like,
right.
fuck it. We were on the way to see another set of friends for dinner that night.
Okay.
And then we called Balky. We called a few people, we called Balky.
Yeah.
And we said, Hops talked to Balky, and she goes, Balky, you need to sit down. And he goes, it's
You
twins.
need to sit
We're
down.
like,
I love that. You
Yeah.
need to sit down.
it is.
Flipping Mr. Know It
like
All.
it-
Yeah.
I know.
Yeah.
It's twins, yeah. All right, say,
Oh,
yeah.
yeah.
All right, cool. Bye. You called me. I was like, what?
How old are you
Yeah.
this point, Indy?
24, 25.
Okay. You
This is
still don't know
2000.
how it happens, I know. You're just like, "Ah, kidda honda, baby, give me honda."
No, I was sitting there and I was like, I was expecting this phone call. What? Twins? Personally, I thought when you called me, I was like, this ain't good news. Because I was thinking
you
of all
are
the
Duki
bad
Bandana.
things. No. But
You
I
are Duki Bandana.
thought the very last time that they told us they were pregnant,
Yeah.
I flashed back to like when I was at the very beginning of their journey, and I was like, is this too early? Because I thought in my head the reason why you miscarried last time is because it's too early. Just me and my naivety, right? And I'm
Yeah,
thinking,
yeah.
have they done it again? And then when this happened, and you called me saying to sit down, I was like, what's happened? I think I said to you, what's happened? You told me, and I was like, okay, relief, but also what? Twins, what? So yeah.
Double trouble.
Yeah, double trouble.
Mm.
Yeah.
And then we told immediate family because they've been on the journey with us as well. At this point, I was 7 weeks pregnant.
Okay.
So I was still quite early, but they did a scan to assess then, because then needed to then get into hospital scans and be on the hospital
the
radar, like
12-week.
have more frequent
Yeah.
checkups and stuff.
Mm.
So from 12 weeks, we had scans done every 4 weeks.
Yeah.
So it's a higher risk pregnancy.
Yeah.
But the twins were the safest version of twins. So they had their own sacs and they had their own umbilical cords,
Wow.
which is called dichorionic diamniotic, which is called DCDA, which is the safest way to have twins.
DCD,
So they've got their own sacs and they've got their own umbilical cords, so they wouldn't have any impact on each other. So if twins share a cord, one can sometimes take from the other and take away nutrients. Other ones then doesn't grow as much,
Yeah.
and there's more risks involved. So this is the safest way to have twins, is to have two separate embryos. So we had a lot of regular tests and a lot of regular scans, which was to us was a normal way of having a pregnancy. We didn't know that wasn't normal.
Mm.
You know, you only have a scan at 12 weeks and then one at 30 or 24, and that's it. Nothing
So
in
that's
between.
every 4 weeks. Beautiful.
Every 4 weeks we
Everything
had
you'd
scans.
been through. I mean, to
Yeah.
you, like you said, logistically, guys, you've done everything around this point.
Yeah.
Yeah.
Just a few scans, right?
Yeah, exactly. Like, okay, fine. I was happy to go. Like, let's see if they're all right. How are they doing today? How are they looking? Is everything okay? So that was a really big thing. And then by 24 weeks, 6 months, I had to pack in work because I was struggling to cope because I was getting pretty big.
Mm.
When I was seeing patients, I had to have a hot water bottle on my back, one on my front, try and do this because it was getting really uncomfortable because I was getting shredded. Muscles were getting shredded. They were doing a lot of bungalowing, definitely.
Clearly.
So ridiculous. So I then signed off myself from work early, and I had sofa rest for 14 weeks. I lay on the sofa and I ate cookies and I watched telly.
Cookies, Maryland cookies.
And I was in pain and I was fucking miserable. I was like, get these things out of me now. I am done with this. It was so hard because you couldn't take painkillers if you don't want to risk anything to the babies. I wouldn't even take paracetamol back. No, forget it. I'll just suck it up. All that helped was having a bath Or midwife said to me,
nice.
no baths. And I was just like, yeah, fuck
Oh,
you. I'm having a bath.
man.
I'm having a bath because this is the only thing that gives me relief.
Yeah.
The hot water bottles were on like a constant looking for a
Conveyor
word
belt.
here.
Conveyor
Yes,
belt.
conveyor belt. We'll get one on, get one off, hot water bottles. And I laid at home for 14 weeks. People were like, oh, Hop, you should chill now, you should get things ready and go to museums, go to art galleries. I'm just like, what are you talking about? I can't freaking move up the stairs.
I can't
What do you
fucking
mean
go to the
an art
toilet. Yeah,
gallery?
leave it. Leave it
Yeah,
out. Yeah.
exactly.
Museum.
But I'm not going anywhere. Go to museums. Chill time. I'm like, this is not chill time. This is freaking pain time. But
Yeah.
I couldn't complain because it's all we'd ever wanted. But it
Yeah,
still wasn't very
yeah.
comfortable.
Yeah.
You know, I couldn't go up the stairs without being out of breath. You know, we tried to go to the shops and I'm like, oh, I need to go home now. I'm just freaking, this is just too
Tired
much.
and breathless.
Everything's
and-
getting pushed up. Everything's getting
Oh
pushed
my
out.
God.
Yeah.
Yes. And then we went to full term, which was good. So full time for twins is 38 weeks.
Okay.
So we went to 38 weeks. And then
You had that scare.
had quite a few scares along the way where one twin wasn't moving as much. Other twin was doing, as I call it, bandement de poussière.
Okay. Yeah. All
That's
that.
definitely my
we all
nephew.
know
Yeah.
which one that one was. Yeah.
Yeah.
Right.
Definitely.
He was a jumper. The little one, my daughter didn't do much. She just like lay there, and I just thought not much movement. So we had a few scares going to the hospital, check things out, be there for a few hours. Is everything still moving? Because there's always a risk of that kind of stuff. So that was always a bit hairy at some point, but it was fine. They were cool. And then when it came to delivering, that was when things got a little bit tricky because I didn't want a natural birth. I was quite scared of a natural delivery.
You
didn't want natural birth.
Okay.
No.
Yeah.
I was scared of natural delivery. Like I could be popping out like 2 kids the size of freaking Christmas turkeys. I'm not a very big frame. I'm like, how's that going to happen?
Nice
I didn't have
description
that at
there.
But it's basically, you know,
nikalooga.
yeah, I was like, this is quite scary. I don't really want that. I'd like a C-section. And the hospital really pushed back on me and they were quite aggressive about it. You know, the kids, both twins are facing head down, you in a good position to natural delivery. You should be doing natural delivery. I really didn't want one, but I'm like, okay, fine, I'll just try it out and stuff. I got induced, didn't work. I was in induced for 2 days, which was horrendous. And they're like, oh, well done. They're like, 1 centimeter, we'll carry on going. I'm like, no, 1 centimeter is not dilation enough. Stop right here. I don't want this anymore. I remember being in tears. Yeah, I remember being in tears to a midwife saying, I don't want this. I want a section. Can you just help me on this, please? It's not what I want for my pregnancy. And then she got a consultant come in, remember open the curtains, and he goes, I hear you've had a change of heart. I'm like, yeah, you could say that. And he goes, you want a section? I said, yeah. He goes 11 a.m. on Thursday? I said, that'd be great. He goes, okay, we'll see you then. That was it.
Pretty
That
seamless.
It was
quick.
as
Wow.
easy as that.
That easy.
It was as easy as that. Like, why couldn't they all be like you? You know, it was as easy as that.
So Thursday te 11 baje theek hai tena dono bacche hain
11 a.m. Thursday?
bas
I'm like, great, thank you very much. I'll have one of those. Thank you.
Yeah.
And then I was in hospital for quite a while. And then we had the delivery. I remember walking into the room and there were 13 members of staff in the operating theatre. I remember counting them.
Okay.
And I was just like, why are you all here? And they're like, because you're a twin pregnancy, it's a C-section, anything happened, we have everybody here ready to go.
Yes.
So there were 2 surgeons, there was an anaesthetist,
Yeah.
midwife for one twin, midwife for the other twin, midwife for me. Oh, okay. They had 3 nurses on standby, ready to go as well. They had, I don't remember who other people were who were in the room, but they just had people just ready for anything that could happen. Like, oh, okay, thanks.
And then you also have Barge as well. Yeah.
I didn't get
Oh, yeah, he's on the side. He didn't get a midwife. There wasn't one for him. And then midwife for him.
Can you hold my hand as well, please?
Yeah. Oh, nurse.
तू
my
मेरे
hand.
पैर का मसाज कर दे मैंने reflexology दिक्कत है
Yeah. I took a pregnancy test too.
मेरा भी positive सी मेरा भी कर दे
You know, I have to admit, when I did that test, I was a bit disappointed it wasn't positive. I was
So
like,
that ounce of disappointment you felt. Imagine what a
yeah,
woman
I was like-
feels. Yeah.
I was like,
Right.
"Aw."
मेरा account था ठीक
married
है
married a बेवकूफ, like पूरा बेवकूफ.
But, you know, you've seen that from
Oh,
Junior.
man.
Yeah, all
So
right,
no,
Arnie.
yes,
all right.
yeah, I was there too. Yeah, I was there
Okay,
too.
good.
Yeah. So they
You were
so
there
they set
too.
it so they set it up and they basically put a screen above
Okay,
Harper's
mum and-
chest, and then the
that's it.
stomach is below, and they said it's going to feel like someone's doing the washing up in your stomach to Harps, and that is how it
Hugging
feels.
and stuff.
That's an
She's got that,
interesting
yeah, just feel
analogy.
like rummaging. So and they said to me, "You sit, by her head and face. Obviously, of course, I not to see what's going on down there."
Yeah.
And that was it. It was, in my mind, it was. I mean, you'll have a completely different experience. It was really quick.
It was quicker as well. I agree.
Mm.
It's very quick. And then that's it. Kiwi came out at 11 o'clock. And I said, is she okay? They're like, she's absolutely fine.
Yeah.
She was
Nahal
quiet
came
though,
out.
wasn't she? When
She was
She
like
cried
a
with-
normal, cried a little
Yeah,
bit, normal.
She cried as a baby cries, but then Nahal came
Yeah.
out, and bloody hell, man.
Hola.
And even the
Oh
surgeon
my
was
god.
like,
Sergio was like, "Whoa,
so
dude!"
Nahal's face, he was doing this. Like, it's got this, and like that picture, is it
Scream.
Francis, is it Months? The
Munch's
scream. That was his face. He was like,
Oh, okay.
as in, what are you doing to me? I was happy in there. Why are you taking me out of this?
ਸੀ ਤੁਸੀਂ ਮੈਨੂੰ ਕੱਟ ਦਿੱਤਾ
And he looked quite scrawny when he was born. And so she was 5'5", 5 pounds 5 ounces.
Right.
I weighed him 5 pounds 11. I said, what? 5'11". I said, are you sure? Because he looks skinnier than her.
Where
I
is
don't
the
know.
weight?
Yeah, it was all, I don't know, in his lungs or something. I don't know, because he screamed like hell. Everything was normal. We were very
Nice.
grateful. That was all sorted. Packaged him up. Next into the aftercare room. See you later. And the rest of it, they say, is history.
And
And
had you guys decided on names already, or was that like an after
Yes.
thing? Yeah, so you
we
knew.
had names
Yeah.
decided from 10 years ago.
Wow.
before we even started having the kids.
Wow.
We'd already
Okay.
chosen their names.
And
Yeah,
let's
from
have the
10
names again,
years.
guys. So Nahal and
Kiwi.
Kiwi. As in
Kiwi.
Mata
Kiwi.
Kiwi.
Mata Kiwi. I was going to say, yeah, it's a very rare name, but it's a beautiful name. Wow. Nahal, very nice names. Powerful meanings. Wow.
Yes, that was the reason behind the names. They had-
names and meaning.
Yeah, that was a big deal. So
So
Nahal,
we didn't. Yeah,
those
we
who
didn't go.
don't
We didn't
know.
go to the Godra to get the yucca. We didn't get the yucca from the Godra, did we?
Hmm.
We
we
were.
didn't know.
We were told
Modern.
to, and we said no. My attitude was, this is our journey. I'm choosing the names.
Yeah, I don't
Yeah,
blame you. I would
absolutely.
too.
Yeah,
Ultimately, it's about respect, isn't it? I mean, I presume you took the kids methodically. At
we
some
did.
point,
Yeah,
look at
yeah,
that.
we did that.
Yeah,
we did
so,
that. Yeah, we did that.
Yeah. It's all about
Um,
intention, isn't it?
we chose-
Mm,
Yeah, and then when we told the parents these are the names,
mm.
I think they were pleasantly surprised. They were like,
The-
"Oh, okay."
You've gone a bit
Were
like
they
rather
expecting,
than,
like,
fusion, Jason,
Fusion, yeah.
you know,
whatever.
Melissa,
Jason
They're-
Parler.
You know, like these
Jason Ball.
pretty
I know a guy
like,
called Jason Parler. That's
pretty-
why I said it right.
Jason Paul.
Yeah.
wow.
They were probably
Yeah.
expecting, kids' names like, I don't know, Sally or something, or Dave.
Rihanna.
I don't know what they were
Dave.
expecting.
Dave.
ਮੰਮੀ
Right,
ਡੈਡੀ
Dave.
ਤੁਹਾਡਾ ਪੁੱਤ ਹੋਇਆ ਤੇ ਉਹਦਾ ਨਾਂ ਹੈ ਡਾਈਵ
What Dave?
Oh, man.
Dave.
ਡੇਵੀ ਉਹਨੂੰ
Jesus.
ਡੇਵੀ ਕਹਿੰਦੇ ਆ ਅਸੀਂ ਪਿਆਰ ਦੇ ਨਾਲ ਨਾ ਡੇਵੀ
So then when we told them, they're like,
my God.
"Oh, okay, nice
Yeah.
names." We're like, "Thanks, we're not complete morons. We chose names that meant something to us as well.
Yeah, yeah.
Give us some credit here, yeah."
So all in all,
And-
that's an 8-year journey.
Guys. Wow.
They were put
So,
2015. We started in 2000 and begin 2000. Yeah,
No, 2009. 2009. This is
Well,
6
yeah,
or
I
7
mean-
years.
yeah, something like that. It seems an age away now.
Mm.
Because then when
How
they
old are
come,
your
it's
kiddies
really-
now?
yeah, when they're 6.5 now.
They're 7.
Nice.
Yeah, they're 7 in June.
Nice.
And it's interesting, when people say that when you get what you want, you forget all your dukhi.
Yeah.
All your dukhi is forgotten, and you do forget, because the one thing that you wanted, the one thing that you asked for, and you suddenly received it, You forget all those nights of crying yourself to sleep. You forget all those nights of hopelessness feeling and feeling like a failure. You forget it's all gone. In a heartbeat, it's all gone.
Until your brother asks
What
you
you've
to come
got
on a
now is
podcast
another
and
kid
bring it back
still
up.
giving you sleepless nights, still crying. It's just not you. That's
His
it.
name is in the video.
name is in the video. Yeah. Right.
But you just deal with the problem that's in front of you, don't you? And kids bring with them a lot of challenges, so you just constantly deal with them all the time. I do try to make myself remember what we went through to get them, because I don't want to forget, because it's because it's formative for you, right? Not for them.
Your journey.
'cause-
Yeah.
I'm sure there's days
formative.
as well where things get difficult and you just probably have to take a step back and think like, we went through all that to get to this. It's really not that bad in the grand scheme of things.
I mean, don't get me wrong. There's days when you think, this is fucking hell, what have I done?
There's days where you say, where do I get a refund? Refund
yeah.
के 10 mil that
Barcelona that
refund on my
ticket
Boy,
kids.
one day the kids are going to listen to this, you know, careful.
They know.
That was actually my next
there's-
question. At
Mhm.
some point, when they're of an age when they can really understand the gravity of what you've been through, will you explain, this?
Yeah, the egg
journey for them?
donation, everything. Yes,
this.
yeah, we'll be quite
Yeah.
open with them.
It's not a secret.
They look.
I'm sorry, no,
coming
I
soon,
didn't
actually.
specifically mean that. I just meant the whole, that 8 years, man. This is a big emotional thing for them to know how
Yeah.
special life is special, right? And we say that, and but like you said, there are people who just become pregnant so easily, and then for other people, it can take a long time. So yeah, so
I can remember vividly at Balkeet's wedding, someone saying to me in the kitchen, don't you want to have kids yet then? You've been married for 7 years. And I remember just thinking, bitch, you have no
If
idea
you
what
knew.
we've been going through. Yeah, what we've been going through behind closed doors. And, it's the, when they ask you, how many have you been married now? And you're like, oh, no kids. Like, well, what do you think the reason for that is? And, and I remember saying to her, I can't have children. And just shut the conversation right down.
Right.
That was because at that point, I remember going with the storyline. You said you went through a really tough period and you just said, I want a break. That's probably,
That's
hence why you
that
may have given a
cycle.
reaction like that, saying, I can't have
And I've
kids. 'cause
never
you're probably thinking you can't have kids.
What did she say
and I've
back
never
when you
forgotten
said,
that.
I can't have kids?
She goes, oh, you probably don't want them. They're quite hard work. And I'm just like, well, no, there are lots of reasons. I just didn't want to deal with that. And it's just
You don't
too
want
much.
the shit anyway. You're all right with that, kids.
No, it just shows that people really, first they're rude enough to make that presumption, right? And then they're not emotionally ready enough to be able to handle a conversation. If you said, I can't have them, and their response is, you probably don't want them, that's even more appropriate than the first statement. It's just like,
Yeah, but also it's probably them being flustered from having someone say that, because normally
They
you'll
didn't
give
expect
an
that as a
answer back
reaction.
saying like, oh,
what do you say now?
not yet, Halini, there's other reasons, but they probably didn't expect it to say I can't have kids. They're like, shit, every time I've said this to someone, they never said that to me, right?
Yeah.
So
Yeah. Because it takes balls,
So-
man. Like,
But people
My
forget because.
takeaway,
Go on, carry on.
I'm gonna say my takeaway for this is that, when you see couples who haven't got children, just keep your opinions to your fucking self.
yeah,
No one wants to hear what your thoughts are on this. No one wants to hear about which
Thank you.
bar to go to, or where you should be going, or lay with your man 3 days after your period finishes. No one wants that. Unless they ask for the advice, unless they say, "Auntie tera ki khayal," or
ऐसी कोशिश नहीं की।
yes, unless they ask you, just keep it to yourself, because you know what, none of your business. None of your business. And that's my biggest takeaway from all of this is, you don't know how difficult it was, and we're miscarrying, all these things that are going on. Just keep it to yourself.
You
love.
don't know.
No one
isn't
wants
it?
to
I mean,
know.
That's,
I remember
tell you
when we went to Canada. We went to the Yukon first, and then afterwards we went to Vancouver to stay with your relatives. And then your uncle gave us his car. We went to see a few relatives. Do you remember?
Of yours.
We went to see my cousins, saw them. Then we went to see another uncle of mine. My mum said, make sure you go and see him. Forgot his name. And we went fun. And this is 2014. We've been married for 9 years now. And he goes, what? Because you're not pregnant yet, because you haven't had kids yet, have you? And I said, well, no.
Obviously.
I left
I
him in
left-
England, mate.
Yeah. I was like, well, no. And he goes,
Obviously.
and he leans in, really concerned. He goes, ठीक है सारा कुछ. I said, well,
सामान चल रहा तेरा?
I was like, yeah, it's all right. I was like, yeah, why? And he goes, and there was so much concern on his face that we hadn't had
Genuine
kids.
concern.
He was really, he was going to have a heart attack.
Oh,
It was
wow.
like, and he's like,
Jesus.
ठीक है सारा कुछ. I said, well, yeah. I said, unfortunately,
Yeah.
sometimes it takes a bit of time.
Yeah.
And he
yeah.
goes, but you've been married 9 years.
He just came back to that one thing.
I was like,
He went full circle. Ooh.
9 साल हो गए? काम
He
ठीक
goes,
और 9 साल हो
he
गए?
goes, doctor ने गया था सी. I said, what? I said, well, yeah. He can that.
Oh God.
I was like,
Do you want me to send you the
Yeah.
report?
when you have this conversation in Punjabi, it just sounds so
I know.
like blunt. It's like
It is quite blunt.
oh my God. There's no like, acha, I got some nicely put up and there's none of that. It's just simply what the fuck's the doctor said.
what am I going to
basically.
say?
Ah,
What would you
yeah.
have? I toyed with it. I thought, what could I have said?
Right.
I said, Mama ji, मेरी ਜਿਹੜੀ दोस्तों है ना, वो काम नहीं करती. I was like,
No, you did not.
No,
He
wait,
said that,
but you think back. I said,
If
what can
you
I? What can?
said that.
And thing is,
You said that.
when you think back about it, at the moment, you just say, let me just be polite, because he's he's saying it out of concern and love, but his
intention, yeah.
his
way
delivery, of
he
His
said
it
delivery
just
is
terrible.
not good.
His bedside
Yeah,
manner.
Yeah, exactly. It could be
Had
not
you said that though, I reckon the next line would be पुत्त
the common.
नहीं पुत्त मेरे को
I just think, कि
गोरी
होया.
हैगी है तू बस
दवाई चाहिए था?
खा ली ना वाह तेरा काम ना ऐ हो जाना बस मैं कमा देना बस हो जाना.
I can't tell you what people used to call him.
Oh.
He got yeah. I
No,
won't
you
say
can't dip it. Got condition right now. You can't say that. Okay. I'm a deep.
Off air.
Yeah.
Oh,
mhm,
man.
Yeah. I'm a
Okay,
deeper.
don't put this in the podcast.
No.
Okay.
I'll tell it after because it's easier to edit if
Okay, fine.
if
I'll
we do it
tell you
after.
guys after if I
Oh.
ever see you again.
All right, okay.
But yeah, but I mean, the thing is, a lot of these guys say this stuff.
Hmm.
Not a lot of these guys. Some of these guys say this stuff because they are concerned, but it
Right.
comes across in such an insensitive way,
Hmm.
and all it does is hurt the other person because they don't know you to have
Mhm.
that conversation with you.
Yeah.
So there's that thing about
But
having,
they're like massive and that's what
yeah.
they feel like there's a
and they just feel that they can say it because they're older, but it
Right.
didn't. It
Doesn't translate
started
that way.
to not work like that back then, and it certainly doesn't work like that back now. You don't get to pass judgment on me or anything
Mm.
just because you're a generation older. It doesn't
Yeah.
happen like that anymore.
Hmm.
So I mean, just dude, read the room is what you want
read
to
the
say.
room.
To me.
Read the room. I'll tell
Right.
you a funny one recently. So absolutely, you talked about your nanny, yeah, and the infamous 3-day rule.
Mm.
So my nanny, very, 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 very spiritual. Some point last year, says, same question. You're like, have you thought about kids? Not are you gonna have kids? Have you thought about kids? I said, nanny. So I thought spiritual nanny. I'll give a spiritual answer. Jado kirpa honi hai, ho jana.
Yeah.
Mate, there's no comeback on that. There's no comeback
Exactly.
on
You're sorted, innit?
that. Right?
you're
No,
sorted. I said that.
nanny's
Oh.
come back. Right?
Acha.
ਪੁੱਤ ਜੇ ਤੂੰ ਕੁਝ ਕਰਨਾ ਹੀ ਨਹੀਂ ਕਿਰਪਾ ਕਿੱਥੋਂ ਹੋਣੀ ਹੈ? And I was like, oh. I was like, Nani is just a different level. And they started laughing, and I was just like, you win, Nani, you win. ठीक है. You don't expect
I
it.
said that as well. I say, जिथे लिखिया उथे होना, जे लिखिया नहीं ते होना नहीं. And they're like, well, you're right. What can you say to something like that?
Sat button.
And
Yeah.
it's a very similar story that a friend of ours once told us, where there's this guy and he prayed to God, wanted to win the lottery. Like, God, I'm a really good guy. Please help me win. Please help me win. I'm really, really, really great guy. And for weeks and weeks, every day he'd pray, let me win the lottery. And then one day he heard a voice from God, and God said, Mark, buy a ticket.
There you go.
Pretty
You've got to be
much.
in it to win it, man. That's it.
Yeah, man.
Exactamundo, right? You've got to be in it to win it.
Exactamundo,
It's
man.
totally right.
That's
Yeah,
it.
totally
Indy did
agree.
the same thing, and Sanj came along. So clearly miracles happen. So ठीक है ना.
I'll tell you said that.
I tell you all the time, man. तू बहुत lucky guy है.
Buy a
I
ticket.
appreciate that.
You
I
and
appreciate
your,
that.
special bow.
All right, closing
I
statement
know, I
then.
know.
Go on, go on.
Mhm.
No, go on.
I was
go
going
on,
to say,
go
I know that there are a lot of aunties who have well-meaning intentions when they say, baby nihoy, like no. And then they say,
Mm.
doctor nige. And then they say, my so-and-so went to this doctor, my
Mm.
so-and-so went to this
Ab to
barber, my
vadiya.
person went to this
Oh.
person, you know, and suddenly they are getting a bit more clued up now. These aunties are getting a bit more wizened up to what's going on in the community. And they're
Mm.
suddenly saying, you know what, have you tried this? Have you tried that? And it isn't just lay with your man, it's, you know, more technical stuff now. They're like, you know,
Technical.
this doctor, this clinic,
This
this
position.
doctor. I really hope not. I really hope not.
This position.
Ale.
Like, imagine.
Here's the Ale Kama Sutra.
Yeah, I was gonna say, come
No,
on,
but
there you go, हो गया.
पुत्त तू सेंट करा ना सेंट पाया कर सीख के ना सेंट
Get rid of that lavender on
No,
the pillow. Yeah.
You know, we forgot to mention seeing an IVF consultant in India.
I had a panic attack then,
Wow.
more or less.
I can imagine. Okay.
Fucking hell, man.
Oh, God.
Why did you do that?
'Cause your mum took us there.
Yeah. He's like, that's the answer.
Oh God.
We were told.
We went
So we went.
shopping
So
for
your
Val
mum.
Pete's wedding.
Oh
Was that,
God.
I thought that was the. No, I thought that was the same
Yes.
time you went. Was that in 2012 then? I thought it was
This is
2014.
about wedding shopping even. Oh.
No, I thought it was the
I
time.
don't know.
No, it was so that trip to
Doesn't matter
Harmandir
when it
Sahib in
was.
India, 2014.
Yeah.
Your mum was brilliant because she got there and she took us on a tour of all the little Godwai in Amritsar. It was
Yeah, yeah.
phenomenal.
Mhm.
Like really back alley Godwai with a lot of history.
Yeah.
And some Godwai that had completely been forgotten and just looked after like one girl. And on that same day, she said, we'll go to a clinic.
Right.
And this clinic was, oh my God, it's like,
Like full
I don't
desi
know.
or
it was, I don't know, I can't even describe it. It was
You
like,
walk
It was
in,
in
there's
Cheltenham.
like a little pakka on the table that's barely doing
no,
anything.
it was like a full-on clinic.
it
You
looked like
go
it
there.
looked clinical.
And
Full
yeah,
waiting room.
it looked
Yeah, okay.
clinical for
it looked
India.
like clinical. Oh right, okay, fine. Yeah,
Right.
yeah.
And you go there and we went
Mm.
in and there's a massive waiting room full of a lot of people were there.
Mm.
And we go in and we see the doctor and your mum did a lot of the talking. I'm like, I do not want to be here.
Right.
Mm.
I really did not want to be here.
Yeah.
I think she told us she wants us to go and see a doctor, but I wasn't prepared for how hard a sell the doctor was going to give to us. So it wasn't. This wasn't
okay,
on your
the
mum.
pitch.
This wasn't on your mum at all.
Okay.
But he was like, the woman took us in. Doctor sat us
Yeah.
down, and he goes, "What's
Yeah.
happened?" And he's like, an Indian doctors, businessmen, professionals do this. They promise you everything.
Oh, sir ji, sab ho jana. Oh,
Yeah.
100%.
We'll get you pregnant. You'll have hundreds of babies.
Yeah.
And it's always hyperbole, isn't it?
So,
Yeah,
it is,
baby
yeah.
ho jana.
Yeah, we'll get you pregnant.
Yeah.
Well, I was like,
Yeah.
okay,
Yeah.
we can start the treatment next week. I was like, what? Hang on.
Yeah.
Whoa there, fella.
Where's the scan?
Yeah. I've just come in to get maybe a second opinion or have
Do
a
the
chat
plant again.
about discussing what the possibilities are of getting a second opinion. Maybe you're ready to start injections now.
No, this guy is like, we got bacche piche tu aa le la.
Worse comes to worse.
Ready.
Take it.
There he is.
And
His
the
name's Manj-
criteria was
Aranjitya, Lena. And it was like, and I remember I ran outside and Harps came up. She goes, "What's wrong?"
Oh,
And
wow.
I said, "I don't
Bloody
want
hell.
this." And I said, and I was like, "What the hell's going on here?"
Yeah.
one of the
Um,
criteria was I had to stay in India
Yeah.
for 3 months
Yeah.
on my own
On
for
your own.
treatment.
Yeah.
I'm just like, I'm not fucking staying in
Fuck
India for 3 months. What am I
that.
going to do here? I've
But
got a
this guy
business
had-
to run.
So he had a treatment plan set out. This is the
Okay.
treatment plan. You stay in
With
India for 3
expungement.
months. Yeah. I was like, what the?
Standard treatment plan. Standard
Yeah,
plan.
it was a cut and paste treatment plan. Wasn't bespoke. Didn't take
Mm.
into account anything. Had done no tests.
No
History
past
plan.
medical history.
Didn't ask about your
Kuch nahi,
history.
nahi, nahi,
Yeah.
no,
Medical
no.
history,
That's-
no problem.
That's it.
But by the
Basics,
way,
it's all basic stuff.
but by the way, you'll be pregnant by the end of it.
Yeah, must.
And I just thought,
guaranteed.
and I thought, I'm in the game of healthcare. I know you're chatting shit.
You know what? You could have walked in there, right, and had your whole ovaries taken out, and he would have been like, yeah, no problem. I'm like, wait, what?
Yeah, you ain't
What?
touching me. I'm leaving. You ain't
Yeah.
touching me. I randomly remembered that.
And then
Thinking
your mum,
about-
and I was outside, and I said, I can't. And I said, what the hell? I can't. There's no way this is happening. I'm not prepared for this. And then Harps had a chat with her mum, and then your mum went in and said to the doctor, yeah, look, you know what? This is not what we came for. See you later, bye. And that was the end of it.
So well-meaning stuff that came from recommendation from somebody who told my mum. How so and so went to this clinic. Somebody went to here in India. When you're there, go to this
Can be
place
hit
as
and miss,
well.
I guess, is the caveat.
Yes, it's the well-meaning stuff.
Yeah.
So they, there are good intentions. It's just these people who you meet along the way may not be as well-intentioned as maybe what you would.
Yeah, agreed.
It's that thing where you're, as a coach, you don't give solutions. You ask questions, and I think that's what people can learn with, rather than going in and say, well, you haven't had babies yet. What the hell's the matter with you?
What's the problem with you?
Just ask them, how are you okay? How's things? How's life? And go from, and if that person feels like they want to open up about having fertility problems, then they'll open up. If they're not, then walk away.
Yeah.
It's not about you don't owe anybody anything in terms of talking to them about your problems. Why haven't you had kids yet? You know what, Auntie, with all due respect,
Fuck off.
Fuck off, right?
With all due respect, I don't feel I need to talk to you about this.
You're not in the inner circle, man. You ain't in my inner circle. If you were going to need to know, I would have told you by now. If you don't know, there's a reason why you don't know, because I don't know who you are either.
Exactly.
You're not in the
Makes sense. Jesus. Well, guys, thank you for coming on. I do have Jesus is in like just thinking it all makes sense.
Oh my god.
I was like, I need to go to sleep. No, I don't. I was thinking, in the interest of time, it's probably best to round it out because it's been 2 hours.
I think we should.
Yeah.
I haven't finished my wine. I can carry on talking.
Okay. 2 hours, 10 minutes.
I know where we go when that happens.
What's the best way for people to contact you if they want to just have some advice?
Just reach out on your Instagram, I suppose. And
I'll tag you guys in it on
handles.
Instagram. Fine.
Yeah.
Digger.
Totally happy to talk to anybody who wants to talk about it.
I'm happy to chat to any guy who wants to talk about it, or girl.
Yeah. Go to the Indian Doctor
anyone.
page then. When this is released, they'll be tagged in the post or whatever. And if you can't find them, just DM us and we'll point you in the right direction.
Yeah, and I think if I can get, I'm not going to give any advice because they're probably fed up of everyone giving them advice.
Which is what I'm saying. Yeah, it's probably not best to have blanket
I think you
advice.
know what, go with your gut. If your gut tells you something's right, then listen to that. What worked for us, even though we tried a plethora of things, isn't going to work for everyone else. But I'm happy to chat to anyone.
Also, whatever your options are, whatever you choose to go down the end of it, love isn't blood. And and that was a thing for me, that my children are not my genetic material. They don't match me. Are they going to look like me? Are they going to be me? If you adopt, if you foster, if you do surrogacy, if you do whatever, love isn't blood. It's much more powerful than that. And your destiny is already written for you, whether you like it or not. All those years we had to go through, but the gift we got at the end of it was we had twins. And we couldn't ask for anything more than that. But I didn't know that was our fate until the very end. So what you're going through right now, there's a reason why. It's because you can handle it, because you've got this. You just didn't know you got it until you realized it now. And have faith in yourself. Listen to what you want to do, and you do what works for you. Fuck the rest of them. If you're not happy with it, then don't do it.
Yep.
My kids don't look like me that much. So people are like, are they yours?
Kibi has your ears, man. I've seen your baby pictures. I've seen her baby pictures. Your ears are identical.
So I just after that. So my kids are the kids are really fair skinned. They're probably a bit fairer than ours, and I'm well lit here, so I'm a bit darker. So And so I had a picture of them I had a picture of them. This is a true story. I had a picture of them in my testing room, and then like just there on the side, I was examining this lady, and she goes. And she goes, how's it going? I said, well, a bit tired. I've just got kids. She goes, oh, okay. And she looked at the side. She goes, oh, they're not yours, are they?
Like, मैं ग्वांडिया ने बच्चे अच्छे लाना है ना, because I like looking at them. Yeah, not pedophile.
Yeah, that came with the frame. And I was like,
That came with the frame. You idiot.
I was like, no, they are. She goes, oh, okay.
Okay, toy.
She must have been thinking
So
like he's
his
married someone
DNA
white. He's married someone white. That's what they're
Right,
thinking.
His
Yeah.
DNA looked nothing like him.
Yeah.
Every day
Yeah.
the sometime करता है. Oh man.
My word.
So there's my takeaway to that.
Yeah.
That's going to be the quote, Indy, for our thing, man. Say it again.
Which
Love
one?
is not, what was it? Love is not blood.
Love is not blood.
Love isn't blood.
Mate, that's just
Love isn't
that's so
blood.
powerful.
Yeah, and we talked about adoption, all that sort of stuff, and who knows
Yeah.
where the journey would have ended if this didn't work. So
Yeah.
it doesn't
Yeah, I
have to be
think
the
that
end.
was probably your last step after that, isn't it? Like, I'm not saying last step in a bad way, but after all you've been through, that was probably the next logical thing to do.
Next thing for us was surrogacy and then adoption.
Yeah. Okay.
Just adopt
If
India.
I couldn't carry, then
that's what-
surrogacy.
I mean, Benji did practically raise me as a second
gonna
mum
say,
as a kid,
man.
but yeah.
That's it.
She had good practice, and she calls her
I had
son.
good practice.
She calls me her son all the time. As in, like, she'll say her son's name to me when I'm
Yeah.
around her, or
Yeah.
opposite, and I'm like, "What are you doing?" And she said, "He looks just like you when you were a kid." Because I was really fair skinned as a kid as well, contrary to how I look now with eczema. But yeah, I was very, very light skinned.
Mhm.
Yeah, we went to your parents'
love-
evenings. That was
There you go.
Yeah.
That was a good time.
We did. We used to go to
You
parents'
did.
evenings,
You
Mum and Dad
you
couldn't
talked about
make
that in the wedding speech. I remember actually. as
There we
well.
go. Went to
yeah,
the parents' evening. One of them
Yeah.
kept asking, "Was Dips my dad?" And he kept saying, "No, I'm not." And she asked him that 3 times in the space of the same slot. He was like, "What? No."
He's like, some days I am, some days I'm not. These are my kids. They don't look like me. I'll be bada bacha hi hai. I'll be bada bacha.
yeah. I was like, yeah,
Ranjit-
may as well.
Ranjit-
Yeah.
Ranjit to tu hi aaya.
Jesus.
Oh man.
Thanks
Alright,
for the
we'll leave
interview,
it
guys.
there.
Thanks for listening to our story. Thanks
No
for
worries.
inviting us onto this. It's been
Oh.
interesting to relive the journey.
I mean,
If it helps anybody else.
this goes out to Karan, really. This is all his idea. I didn't know if you guys wanted to talk about this. To be honest, it's not something I brought up with you. But
Well,
when Karan met you guys,
I'm going to put it
he
back on
wanted
these
to.
guys.
yeah,
That evening after your reception, after we
Yeah.
all really got really close, it ended with you wanted recommendations for where the nearest McDonald's was. But before that, we had quite a journey. I'm
Are we going to do a podcast on that?
Oh man, you were so funny, dude. You're so animated. You were like, we need to get local information from local bande. You were like, he lives here. He'll know where McDonald's is.
At McDonald's.
But prior to that, though, the journey we went through, I don't know how we got there, but when you mentioned it, Indy, at that point, because guys, in our podcast, now okay, we're like 50 plus episodes in, but we were like, what is the niche? What is it, what we want to do with this podcast? And actually is to bring light to these things that are not talked about in our communities. In a way where, like you said, in place of non-judgment, to make other people feel that they can come and speak about these things, and to have done it in such a very, very personal way. I want to say big thank you to you guys to just opening up, man. Like this is, you laid
it's not easy to
everything
talk about.
bare, everything. And it's been really, really insightful for me, man, both as a medical professional, but really as someone who's going to be on that journey soon as to, what this looks like as a journey. So deep from bottom of my heart, thank you very, very much for coming on today.
Sincerely, if you ever want to talk about anything, if you or your wife want to talk about this kind of stuff, Chindi, you're welcome to discuss with anything. And, it's confidential. Anybody wants to talk about this because it's a difficult thing to go through. And if you have people to talk to about it who can get it,
Relate.
it
Yeah,
really
yeah.
helps. We had no one to talk to who'd been through it already, who were our generation, who looked like us, who we knew and trusted. We were the first ones who were doing it. Everyone else was all, fucking fertile, innit? So, they were all whacking them out, and we
That
couldn't
should be
get
in a
any
bio
of
on
that,
Insta after 3 kids. Fertile, isn't it? Right, that's it.
so fertile as fuck.
Put that on a t-shirt.
Proper jack.
First, no, it should say fertile as fuck, and it should be a pregnancy t-shirt. That's what it should be.
Yeah,
Right.
it
There's your
should be.
niche.
Or Kaam ho gaya.
Mate,
Kaam ho gaya.
okay, Indy. I want to make some
T-shirts.
t-shirts.
Kaam ho gaya.
We need a podcast t-shirt with the best lines from our podcast, and that is making the t-shirt, man.
Kaam ho
Kaam
gaya.
ho gaya.
Kaam ho gaya.
After 3 days, 3 din baad.
10 दिन बाद question mark काम हो गया.
Kaam ho gaya. What the tera kaam chalda? This is so nice.
Oh, it's gonna go forever, man. Oh wow. All right, thank you
Thanks for
guys.
this
Thank you for
again,
reaching
guys.
this far. And
Thanks
thanks
for
to
having us.
Hops and Dips or Benji and Barge, as I like to call them, for coming on.
We appreciate it. It's good to you. Good luck to you guys. What you're doing is awesome, and well done for
Thank you.
reaching out and for having the chats that you're having. And may long may it continue.
We will try and continue. I need to have a word with Karan now and ask him about what's the plan after he has kids. But I'll take that off there. Yeah. All right, cool.
I'm going to retire from the
Because
podcast.
him having kids
Yeah.
affects me too.
You'll never see
Alright.
me ever again, and that's
Your babysitter.
Pretty much.
Yeah,
Maybe.
exactly.
yeah, that's a good idea, man. Yeah.
Babysit my kids first, man. Never mind that. Never
Seva
mind your
karya
kids.
kar.
Go babysit our kids
Indy,
first.
seva karya kar. Okay.
I'm talking to you, mate.
Booking.
Practice. All right.
Booking
All right,
Karla Bella.
thanks. Let me
Okay,
wrap up the
guys. See you
podcast,
later.
man. I've tried 4 times. Okay.
Go for it, go for
Jesus,
it,
let
go
me
for
do
it.
In the
this.
Indian
Go for it.
circle, man.
All right,
I'm quiet.
okay.
Go
I'm quiet.
ahead.
You did.
Go
3
ahead.
minutes to 11. Someone Janahon. It's a school night. Okay.
Go
All
ahead,
right.
wrap
Thanks,
up then.
guys. Thank you for
Okay.
making it this far. Thank you for listening as well. Let us know if you have any thoughts or feedback. Please do share this with other people that you think would want to have a conversation like this. I think it should be spoken about with your friends, your peers, etc. Even if you're not in that place in your life, it's just a thing to consider. So we will see you guys soon, and I will see you, Doctor, soon. All right. Later, guys. Bye bye.
See you
Bye.
later. Bye.